Good morning, everyone. Welcome to all the dignitaries, delegates, and students who have joined the CME tonight on the occasion of World No Tobacco Day 2025. Each year, WHO observes May 31 as World No Tobacco Day to highlight the health and societal risks associated with tobacco use and to advocate for effective policies to reduce the tobacco consumption. The theme for 2025 is Unmasking the Appeal, exposing industry tactics on tobacco and nicotine products. This year, the campaign will focus on revealing the tactics that tobacco and nicotine industries use, make the harmful products seem attractive, which continue to lure our children and youth. This CME aims to educate, engage, and empower healthcare professionals to combat the evolving tactics of the tobacco industry, especially those targeting our youth. I now request Dr. Tanveer Kaur Sidhu to kindly come forward and welcome our esteemed guests of this event.
Greetings, esteemed guests. On behalf of the organizing committee at Adesh University, Bathinda, I, Dr. Tanveer Kaur Sidhu, Professor and Head of Community Medicine at Adesh Institute of Medical Sciences and Research, extend a heartfelt welcome to each one of you gathered here today. We have convened from across the regions to mark World No Tobacco Day 2025. As we embark on today's continuing medical education sessions under the auspices of Indian Association of Preventive and Social Medicine and Resource Center for Tobacco Control, it is my privilege to extend a warm welcome to our distinguished dignitaries and delegates. Firstly, we extend a hearty thanks to our esteemed patrons at Adesh University, Dr. H.S. Gill, Honorable Chancellor, Dr. Gurpreet Singh Gill, our Medical Superintendent Administration and also the PMC Observer for the day. We are privileged to welcome our respected Vice Chancellor, Sir, Kalna Jagdev Singh, along with Professor R.G. Saini, Sir, Registrar, Dr. Kiran Kaur Ma'am, Dean Faculty of Medical Sciences, who have joined us virtually, and Dr. Pramod Kumar Goyal, Principal AIMSR. Your presence today is an honor and adds immense value to this occasion. We are extremely delighted to welcome Dr. Ashok Bhardwaj, the National President of IAPSM, and Dr. Manish Kumar Singh, Secretary General of National IAPSM. Thank you, sir, for gracing us with your presence. We extend our deep gratitude to the Punjab chapter of IAPSM for their unwavering support. And we welcome Dr. Jasleen Kaur, President, and Dr. Preeti Patta, General Secretary. Your presence enriches this occasion. As proud members of the Consortium of Medical Colleges for Tobacco-Free India, led by Resource Center for Tobacco Control, RCTC at PGIMER Chandigarh, we are honored to have the support of Dr. Sonu Goyal, Director of ERCTC and Professor at PGIMER Chandigarh. We also extend a warm welcome to our esteemed guest speakers for the day who are joining physically as well as virtually. Dr. Rakesh Kakkar, Professor and Head of Community and Family Medicine at AIMSR Bathinda. Dr. Vikrant Ranjan Mohanty, Professor and Head of Public Health Dentistry at Maulana Azad Institute of Dental Sciences, Delhi. Dr. Bharat Uday, Associate Professor of Psychiatry at AIMSR Bathinda. Dr. Pranjal Sharma, Assistant Professor of Community Medicine at Dayanand Medical College and Hospital, Ludhiana. And our very own Dr. Jagrati, Assistant Professor of Community Medicine at AIMSR Bathinda. We extend a warm welcome to our session chairpersons, again both online as well as offline, delegates, community medicine heads of the departments from all the medical colleges of Punjab, undergraduate and postgraduate students participating in this hybrid event. A special welcome to the faculty and students from all constituent colleges of Adesh University who have actively engaged in various events over the past 1 month. Today's CME represents the culmination of year-long efforts and recent intensive activities aimed at raising the awareness about the grave issue of tobacco use. Our theme, From Policy to Prevention, Public Health Frontlines in Tobacco Control, underscores our commitment to addressing this significant public health challenge at Adesh University. Let us unite in safeguarding the future of our younger generations by exploring the theme of this year's World No Tobacco Day, unmasking the appeal, exposing industry tactics on tobacco and nicotine products. Once again, a warm welcome to each one of you. Let us immerse ourselves in the academic spirit that defines today's proceedings. Welcome you all once again.
Thank you, ma'am, for this warm welcome. Now I request Dr. Ashok Bharadwaj, President, National IAPSM, who will be joining us online for sharing his wise words.
Thank you. So, esteemed guest, I will not name any particular person of the management of Adesh Institute of Medical Sciences and Research, Bathinda, my Secretary General, Dr. Manish Singh. So, I'm sorry I could not see the North Zone representative from Punjab, Dr. Sarit Sharma. So I will take his class afterwards. So I will concentrate only on 2-3 things. So one is we say policy. The policy for tobacco control or against smoking is very, very old. We are going through, but we are not having the practical shape to this which we should get. So the the topic here, the comprehensive public health policy for tobacco control, especially for frontline levels. So we require a multi-pronged approach that include prevention, the education, and the support for cessation of smoking. So I know that PGI Chandigarh, under the leadership of Dr. Sonu Goyal, he is the visionary for tobacco control activity in our country. Single-handedly, he is taking this tobacco control to the highest level. So I congratulate him, and I congratulate the Punjab chapter. Again, I congratulate Punjab chapter and specifically Dr. Tanveer Sidhu for organizing this CME. So the main focus should be on preventive tobacco use, means initiation, the protecting non-smoker from passive smoking, and the helping the others to quit. So we know that very early age, the children start smoking. They imitate the elders, or it is peer pressure that they start smoking, and perhaps most of them, they are hooked by 21 years. So my focus is on the youth, which is about 30% of Indian population. They are the potential target of all the industries which focus on them, which target them, which allurement. With 13-15 years is the main target. Then they have the electronic product. It's small, it's flavored products. Then good packaging and imaginary that make additive product even more appealing to the youth. So company launches new product and that side effects are not included in the current laws. So they find the ways and means how they can excuse themselves to the current laws in the community. So what I will say that the Indian Association of Preventive Social Medicine, we have to develop a youth-centric mechanism for leveraging tobacco control in our country. So since my Secretary General is here, we on behalf of IAPSM, I will commit many things. Okay, so we have to have the youth-friendly cessation program, essential for those who have already started using tobacco. These programs should be accessible, then confidential and supportive, offering counseling, resources, and peer support to help young people quit smoking. So, as In IAPSM, the national president, I will expect from our young leader of Indian Association of Preventive Medicine, they have a vital role to play in harnessing the potential of young leader, their peers for tobacco control. So young member of IAPSM are uniquely positioned to lead these initiatives given their expertise in public health, their enthusiasm, and their connection to their peers. So I will not say that IAPSM can establish. We should establish. So right from 1952, now we are hearing should be done, should be done, should be done. But who will do it? We have to fix the responsibility. Yes, this activity has to be done by this person. We go to the field, we go to the sub center, we go to the PLC, and they said the workers say that sir, this should be done. This, but who will do it? So we in IAPSM has to establish mentorship program where experienced public health progress professional guide young leaders in developing and implementing tobacco control strategy. So this mentorship can provide the necessary knowledge, skills, and confidence in the young leader to take bold decisions. So we have to encourage the young researcher to focus on tobacco control, which can lead to innovative solutions. Without innovation, we cannot move forward. The age-old policies, age-old intervention will not help us. We have to innovate, and these young leaders of IAPSM, they can innovate and they further can lead us far so that our country can think of being tobacco free. So we I will my secretary general is there. We will try to facilitate collaboration among young leaders across different regions so that we can amplify the impact of tobacco control efforts. So we IAPSM, yes, this CME by Punjab chapter, again congratulate them. These type of CMEs, the workshops, and online forum where young leader can share best practices, the discuss challenges and develop coordinated action. We have to have a coordinated actions. So recognizing and celebrating the achievement of young leader in tobacco control can motivate other to join. So we'll discuss with my secretary general. We should institute awards, scholarship, public accreditation program to highlight the contribution of young public health professional. So in the end, I will again say because we are concerned with the prevention, so integrating all existing strategy for protecting youth is the way forward for achieving tobacco end game in India. And IAPSM as such has a great role to play through their young leader. So tobacco-free institutional educational institution will be the game changer. So thank you, Tanveer, for giving me a chance to attend this address the young leaders and other members of IAPSM. So thank you very much.
Thank you, sir. Now I request Dr. Manish Singh, Secretary General, National IAPSM, for kindly sharing his thoughts with us. So if we can.
Good morning. Am I audible? Am I audible?
Yes, Manish.
So, good morning to all esteemed participants for this CME. And I would like to congratulate the entire organizing team from Adesh Institute of Medical Sciences, led by Professor Dr. Tanveer Kaur Sidhu ma'am, the organizing chairperson for this CME, and Dr. Japneet Sidhu ma'am, the organizing secretary for this CME on the topic of policy to prevention, public health frontlines in tobacco control. And on the occasion of World No Tobacco Day, as Professor Bhardwaj sir has already highlighted some agenda points to be worked upon by IAPSM. So we will definitely work for this and would be interested if all those who are interested on this particular topic of tobacco, how to prevent this tobacco control, so they can come forward and show their expression of interest. We can form a group and obviously we can move forward to suggesting some policy changes or whatever preventive efforts, some research work that we can do. On behalf of IAPSM, we are extremely thankful to Punjab chapter for hosting this CME. And as I could see from the topics, they cover a wide range of topics, including highlighting on this year's theme, as well as from prevention, diagnostics, and the very important CODPA Act. So I wish that this CME to be a grand success, and all the participants are benefited from the deliberations by the very esteemed speakers, what I can see from very renowned institutions. So thank you so much, ma'am, and I wish you all the success. And definitely we'll look forward to work with you on this particular topic. Thank you.
Thank you, Manish sir. May I now request Dr. Pramod Kumar Goel, Principal AIMSR Bathinda, for sharing his valuable insights with us.
Good morning, everyone. First of all, I welcome all of you, all the participants who are physically present, and all the online participants who have joined from all over the country. And I congratulate Dr. Tanveer, Professor and Head of the Department, for organizing this CME on the occasion of the World Tobacco Day, which is celebrated on 31st May. No Tobacco Day, well, no Tobacco Day. So I congratulate, and I know this is a requirement by the NMC also. We have a circular by the NMC also that we must organize events for wide awareness regarding this No Tobacco Day. So I again congratulate this Department of Community Medicine, and I thank that this program is organized under IAPSM. I was still thinking that your academy name is still TSM. Now, the department name is Community Medicine, but it's Indian Academy of TSM. I was just thinking like what I can say about tobacco. See, I am from Forensic Medicine Department, and in Forensic Medicine, we teach tobacco as a poison, and we teach it under cardiac poison. So it's a cardiac poison. So usually we think that smoking will lead to lung cancer. But it is more of cardiac poison. So in forensic medicine, it is classified under cardiac poison because it affects cardiac more than the lungs. Because mainly tobacco, it causes vasoconstriction. Okay, and vasoconstriction of all our arterial vessels leads to atherosclerosis, and we can have like angina-like symptoms also, even myocardial infarction, and that's what I remember. Like I have done my MBBS from Manipal, and in South we used to get a lot of patients of TAO, that is thromboangiitis obliterans, which was very much specific to tobacco consumer. Because there they used to smoke cigarettes, and because of cigarettes they used to have this atherosclerosis of their limbs arteries, and they used to land up with TAO, thromboangiitis obliterans, and sometimes even gangrene, dry gangrene. So I remember that thing, and even I remember one quote from the very famous book of surgery, Valley and Love. Must have, the senior teacher must have heard. Junior student, I don't know whether they read that book or not. Valley and Love. That Valley and Love, there are quotes at the bottom of the book, and in that one quote they have written, either you will have your limbs or you will have your BDs. Okay? So either you can have your BDs or you can have your limbs. Okay. And I know our teacher favorite questions were to ask that quotes what are given in the bottom of the Valley and Love. So please remember this. So tobacco, it causes arterial diseases, and of course we know it causes lungs also. So that will be deliberated in this CMEs. And other thing that CODPA, I just spelled CODPA, that Cigarette and Other Tobacco Products Act 2004. I think we should create more awareness about this act. Even although in forensic medicine, I have heard about this act, but we are not teaching anywhere to students this act. I think we should have more awareness of this act. We welcome our Vice Chancellor, Sir, Colonel Jagdeep Singh. Sir, please come in the front. Please come. So I wish this conference great success for the organizers. Thank you.
Thank you, sir. Now, without further ado, let's begin a first scientific session. Chairpersons for the session are Dr. Ravinder Khera, who is a professor in the Department of Community Medicine at Government Medical College, Patiala. Our second chairperson is Dr. Sandeep Kulab, who is a professor and head in the Department of Physiology at AIMSR Bathinda. She is also the resource faculty of medical education workshops since 2010 in Adesh University. As well, she is the coordinator of the foundation course of AIMSR. She is also the chairperson of the Human Value Education Cell at Adesh University. Our second chairperson, Dr. Ravinder Khera, she has over 17 years of experience in the field of immunization, geriatrics, mother and child care, and occupational health. She has been the co-supervisor in about 9 theses. Now, our speaker for the session is Dr. Jagrati, who is an assistant professor in the Department of Community Medicine at AIMSR Bathinda. She has received Pyarelal Sharma and Mission Devi Gold Medal for Best Thesis in Clinical Department at MAMC, New Delhi. She is also the Nodal Officer of NTEP at AIMSR Bathinda. Along with this, she is a permanent member of the IAPSM Society. Dr. Jagrati will shed light on how the tobacco industry crafts sophisticated strategies to influence young minds and what can be done to counteract it. We welcome Dr. Jagrati.
Thank you, Dr. Japneet, for such a beautiful introduction. And I would like to thank Dr. Tanvi for giving this opportunity to speak in front of such distinguished audience. So, good morning, everyone. Through this presentation, we will try to unveil how multi-billion-dollar industry engineers addiction, not by accident, but by design, specifically targeting youth. My topic is unmasking the industry, how tobacco and nicotine products are marketed to youth. So why even this matter? Tobacco industry is spending billions to attract youth. If we are not making gains among youth, we are not making gains at all. Statement made by one of the top multinational tobacco company, Philip Morris executive. Tobacco kills more than 8 million people annually. 37 million children aged 13 to 15 use tobacco globally. These figures are scary. This is not just a vague threat, it's a global crisis. Youth are seen as the industry's next 40 years consumer. The earlier they start, the more addicted they become, and the longer they remain the profitable. So this isn't just about cigarettes or vapes. Tobacco is often the first product or first addictive substance used by youth. Once nicotine hijacks the brain's reward system, it becomes easier for teens to experiment on more dangerous substances. So what has changed over years? I would say everything. We already know about products like cigarettes, BDs, chewing tobaccos, candy, and whatnot. But now the playbook includes vapes, e-cigarettes, heat not burn tobaccos, pouches, etc. So everything over the years, from the product designs to how it's sold and marketed, are changed. Today's products are technology enabled, sleek flavored to attract Gen Z. Now let's move to the tactics of dissipation, how youth are targeted. And the tactic one is appealing product designs and packaging. As we can see, these are some of the products which are there in the market and are used by our youth. So these are imported illegally despite being banned in 2019. These look like USB style pen-like designs for concealment in schools and these are not detected by teachers or parents and are popular in urban areas including Delhi and Punjab. There are smart vapes. These are new trends. These are devices which comes with games, LED displays, Bluetooth, which is appealing to the tech-savvy generation, young generation. The eye-catching packaging of smokeless tobacco, like gutka, khani, jarda, pan. These are colorful, cartoonish sachets are there. And these are often placed beside candies and snacks. Just next to the candies, there are pouches of gutka and candy, making them just another snack which our youth can snack. The next tactic is sweet trap. That is, these comes in various flavors. Mango, berry, cola, kala khatta and whatnot. Flavored traditional products are also there like flavored beeries, menthol, cigarettes, masala, tobacco. So these flavor, what they do, they mask the harshness, attract new young users. And the gateway hence is sweet. These products are flavored and flavors disguise the harmful impact and make it easier for the first timers to start doing it. The next is digital and social media marketing. So these kind of clips are seen everywhere on social media. These are vape tricks which are shown by influencers or users. Use of hashtags like Vape India, Pan Masala Style, Cool Boys, etc. So influencers, they show vape tricks, youth-oriented content like they use them in parties, reels, lifestyles, etc. And where these can be found on social media, and there is no age limit for seeing these content in media. So even 13-year-old kid can see these content without any restriction. So surrogate marketing. So brands sell tobacco products in the form of elaichi, mouth fresheners, and with similar logos. Like this Vimal packet, which I have shown in the slide, it is for mouth freshener, but similar packet is for which is a tobacco product. So events are sponsored by Pan Masala. We all watch cricket, we all watch IPL, and we see big advertisements of Pan Masala like Vimal, Pan Bahar, Rajnikanta, etc. on the live TV as well. There are private Instagram stores, Telegram groups which sell these products to the youth, and they sell it anonymously. The online payment makes it more easier. These are delivered to doorsteps, and this looks like another technical gadget, which like USB cable, pen drive, or pen, and teachers and parents cannot differentiate. The next tactic which is used is point of sale marketing. So schools and colleges, we see pan masala shops, tuck shops, and chai tapris just near 100 meters away from the schools and colleges, and they sell tobacco, bidi, cigarette, etc. Next is single stick sales. So as we know, our young children, they don't have much money. The pocket money is limited. So single stick sell is also going on. So they just pick up just one stick which costs around 10 to 20 rupees, and it makes them affordable. And they don't even have to ask for the product. They just do this and they get the signal. They do this and they will get the window. So it is the sign language which is now being used to purchase or sell these products. Promotional materials like bag, calendars, pens, we have for gutka and pan masala. Okay. And the gutka packets, these are just placed next to the candies or Parle-G packets or biscuits, just making them just like another snack for the kids. So next tactic is associating with youth culture and so we see smoking in Bollywood. Regional heroes are smoking, and it is often associated with style, swag. The tobacco chewing is associated with manhood. We have manipulative messages that vaping is safer, which undermines the risk perception. Smoke-free is equal to risk-free, which is another information or manipulative message which our youth is getting. Yeah, youth-oriented slogans like freedom to choose, rebel, belong. These slogans are being used on the products, which is fascinating to the young generation. The media is slightly conditioning the youth. They are told smoking is swag, gutka is manhood. The line between marketing and cultural expression is dangerously blurred. And psychology. The industry doesn't sell tobacco, they sell freedom, rebellion, and identity. The teenage brains crave for social acceptance and identity, the fear of missing out. The industry exploit this phase by embedding nicotine use into peer group behavior. So there are many reasons why tobacco and nicotine still reach our youth. Some new products like nicotine pouches, gels are not clearly banned yet. Even banned products are sold easily in shops. Laws are not properly enforced. On social media, it's harder to stop ads, reels, and influencer or user-generated promotions. Flavored products are sold as herbal or mouth fresheners to trick people and avoid bans. Tobacco use is shown as normal in movies, in cricket, events, etc. So these challenges make it easier for the target the youth and harder for us to stop them. So in the last, I would just like to add, we often raise alarms about Uttar Punjab, the visible crisis of drugs like heroin and synthetic opioids. But what we don't always see is smoking Punjab, vaping Punjab, or chewing Punjab, where the addiction story often begins with a cigarette behind a gutka packet near a college gate, or a vape pen disguised as US listing. What we overlook today risks suffocating us tomorrow. That is Gutta Punjab, a state choking not only on polluted air, but on addictive industry and policy inactivity. If we want to tackle the drug crisis upstream, we must start where the slope begins, with the tobacco and nicotine, because every youth saved from lighting up, vaping up, chewing up today is one less life at risk tomorrow. Thanks.
Thank you, Dr. Jagrati, for unveiling these manipulative strategies used by the tobacco industries. That was indeed a wake-up call for all of us. Now, to take this thought-provoking discussion forward, I warmly invite our distinguished chairpersons, Dr. Ravinder Khera, who will be joining us online, and Dr. Sandeep Kular, who is present with us here, to share the expert reflections and guide us through the key takeaways.
First of all, I would like to congratulate the Department of Community Medicine for doing such an apt topic. And Dr. Jagriti, I am very happy that you have shared the first onset topic that why, what are the things we have to look for and where we have to look for. If we know that, then only we will be able to in fact shoot them properly. This is the apt topic because the students are taking it as a false reward system. It's a false reward system which has to be taken now. And that's from my side. Thank you so much.
I request Ravinder ma'am to kindly share.
Morning, everyone. Am I audible?
Yes, ma'am.
So thank you, Dr. Jagriti, for the very enlightening session. So you have elaborated on various tactics and traps which are laid down by the marketing companies to lure the youth for getting into the tobacco and nicotine products. So as we are talking about the preventive measures, I would just like to put up 3 points, mainly which are required for the prevention of this tobacco and nicotine-based products risk. First is strengthening the regulations. Second is strict enforcement on advertisement and the promotions, bans on the promotions and advertising, particularly on the social media and among young people. And lastly, but not the least, raising awareness among young people so that they know about the risks of the products which are being marketed as being harmless or less harmful, and although they are not. So thank you very much. And congratulations, Dr. Tanveer, on organizing this CME on the World No Tobacco Day. Thank you.
Thank you, ma'am. Thank you, chairpersons, for your sharp insights and highlighting how we as health professionals can resist the influence of such unethical industry tactics. I now request Dr. Mohan Malhotra sir to kindly come forward and felicitate a chairperson, Dr. Sandeep Gulab. Thank you, Ravinder ma'am, for joining us. Now, moving to our next session, we will focus on a less discussed yet equally important dimension, the link between tobacco use and mental health. The chairpersons for this session are Dr. Gurmeet Kaur, who is a professor and head in the Department of Psychiatry at AIMSR Bathinda. Welcome you, ma'am. And Dr. Deepshika, who is a professor and head in the Department of Community Medicine at CMC Ludhiana. Dr. Deepshika Kamra, has over 15 years of teaching experience in community medicine and has been involved in various research and projects like dengue call trial, Accent TB project, and MMR vaccine trial. Our second chairperson, Dr. Gurmeet Kaur Brad, has been assistant professor at various colleges like GMC Amritsar and AIMSR Bathinda. With a total experience as a PG teacher for over 15 years, she has published various research papers in different journals at state, national, and international psychiatry. Our speaker for the session is Dr. Bharat Uday, who is an associate professor in the Department of Psychiatry at AIMS Bathinda. Dr. Uday will help us understand how tobacco use affects mental health and vice versa, highlighting the need for integrated approaches in cessation efforts. Dr. Bharat Uday.
Good morning, everyone.
Welcome, sir.
Am I audible?
Yes, sir.
Is my screen visible?
No, sir.
Is it visible now?
Yes, sir, yes. You may start.
Good morning, everyone, and respected chairpersons. Myself, Dr. Bharat, and I'm very thankful to Department of Community Medicine and Dr. Tanveer for inviting me for giving this lecture on tobacco and mental health, a bidirectional relationship. So, as previously in the previous lecture, it has already been mentioned that tobacco is a very ongoing problem in India as well as worldwide, but majority of the people, they don't recognize it as a problem because it has been ingrained in their behavior that consuming tobacco and tobacco products, it doesn't cause any kind of harm and it is socially and culturally acceptable. So this belief, it ingrains the majority of the problems. So to begin with, I would like to quote few lines by a very famous British poet, Samuel Jackson. He told that the chains of habits are too weak to be felt until they are too strong to be broken. So these lines are very aptly suited for this problem of tobacco abuse in India as well as worldwide, because we doesn't recognize it as a problem until unless it is very late for us to recognize it. Majority of the people, they land up in very serious and critical ailments, like most commonly it is lung carcinoma, and then secondly it is followed by the GI carcinomas and urinary tract carcinomas, which are commonly associated with tobacco use. So it is very late for them to revert from that situation. Coming on to the bidirectional relationship, this bidirectional relationship, it means that both of things are vice versa. Like tobacco, it's negatively impacts our mental health. It causes various uh, side effects, like which is very subtle to recognize in a very early phase. Like it causes disturbance in our concentration, it causes memory impairment, it hampers our cognition, it causes emotional disturbances like in the form of irritability, anxiety. So these are very subtle to be recognized in a very early phase. Secondly, how the mental health, it leads to the excessive usage of tobacco and tobacco products, because there are certain conditions, certain psychiatric disorders which are associated with a very increased amount of usage of tobacco products, like schizophrenia and anxiety disorders. Other than itself, tobacco itself is considered as a substance use disorder. So it is a kind of a bidirectional situation where tobacco, it causes the mental ailments, and secondly the mental ailments, they increases the usage of tobacco products. So it is a vicious cycle which goes on and on. Coming to the epidemiology, uh, as per the global adult tobacco survey which was conducted by India in 2016-17, it was found that tobacco is the second largest product that is being abused throughout the world. Obviously, the first one is the alcohol, and in India itself, the prevalence of tobacco use, which is found to be 28.6%. I believe it is slightly underreported. It might be more than that, but because the surveys, they are conducted on a small sample size and then the results are generalized, so we might have missed a few of the points here and there in the prevalence. So I consider that at this survey was done in 2016-17. Right now, if we repeat the survey again, so there might be an increase in the prevalence of tobacco usage. So this tobacco usage is in the form of both smokeless as well as the smokable form. As in the previous slides, it has already been mentioned that in smokeless form, they are coming, it is in the new trend these days, along with the new smokable items like vaping, e-cigarettes, heated tobacco pads. So this has increased the consumption of tobacco among the youth. Tobacco use in mental health. Now coming on to this, that as I have already told, that there are mental ailments which increases the tobacco usage. So the survey found that the prevalence of tobacco usage is near about 45%, up to 45% among the individuals having mental ailments, specifically in those with psychotic illness like schizophrenia and affective disorders like bipolar affective disorders. So this tobacco use, it amounts to approximately 1.3 billion deaths, 1.3 million deaths annually in India, and it is considered to be the major contributor to reduce the life expectancy, both in the way of physical ailments as well as the mental ailments. Now, coming on to how tobacco impacts on mental health, there are multiple factors, there are multiple mechanisms, which I cannot go into detail, but I try to summarize how it affects the mental health. First and foremost, it affects your mood and affective regulation. It causes some kind of dysregulation in your behavior, in your mood pattern, as it increases the anxiety and tension. Whenever the individual is consuming tobacco, the active ingredient in tobacco is nicotine, which causes its withdrawal when it is not being taken in the form of anxiety symptoms. Patient will start complaining of headache, irritability. They will find it very difficult to concentrate on their routine work, and it causes the worsening of underlying symptoms. Like if somebody is already having depression and he or she is using tobacco and tobacco products, so they will have this worsening of their mood symptoms. They will feel more low, they will feel more irritable and dysphoric. Then, as I already told, it causes cognitive impairment in the form of impaired attention. It will hamper your recent memory, and long-term usage, it results in early onset dementia, and it causes executive dysfunction as well. How it interacts with the other psychiatric disorders, like in schizophrenia, the individuals who are using tobacco and tobacco products, there is increased chances of having more hallucinatory behaviors. Hallucinations will increase. There's worsening of psychotic symptoms. There's worsening of manic symptoms if an individual is abusing tobacco. Then they causes reduced bioavailability of the medications which are being prescribed. As some tobacco, it causes enzyme induction in liver, so the metabolism increases. So the bioavailability of the drugs that reduces, hence causing the increase in the dosage amount, which results in further poor compliance among the patient and further worsening of the symptoms. Then tobacco causes sleep disruption. Sleep disruption, as it hampers the sleep-wake cycles, it impairs our biological rhythm, circadian rhythm. It causes a reduction in the melatonin secretion. So overall, the quality and the quantity of the sleep is impaired, and hence it further worsens one's mental health. Then tobacco use may be associated with increased suicidal risk. It is not a direct association, but an indirect association. As for an example, in schizophrenia, there is increased propensity of having hallucinatory behaviors, and hence it can lead to the suicidal activities, suicidal ideas, and suicidal behaviors. Whereas in case of affective disorders, it causes worsening of symptoms, affective symptoms, which further enhances the chances of having higher suicide risk. Now, coming on how tobacco influences mental health conditions, how the mental health conditions they are going to affect your tobacco usage pattern. Individuals having mental health issues, they perceive tobacco as a form of self-medication to relieve their anxiety. It begins with, as majority of the youths who are going through some kind of emotional turmoil and emotional dysregulation, they start using tobacco as the first substance. That is why it is considered as the gateway drug as well. So they start using tobacco to relieve their tension and anxiety, and then they land up in a vicious loop of using this tobacco and again whenever they found themselves in some kind of vicarious situations. They use tobacco as a mechanism of mechanism to control their negative symptoms at that moment, but they don't know that this continuous usage will further worsen those negative cognitions. Then continuous tobacco usage, it also hampers the socioeconomic status, as majority of the population they belongs to a low to middle socioeconomic status, and approximately expense of month for an individual is near about 1,000 to 2,000 rupees if they are smoking cigarette every day. So it causes an added burden, financial burden on the individual, and hence it attributes to the increased chances of landing up in poverty. Then there are certain misconceptions among the individuals, as they believe that once they start smoking, and if they will discontinue it, then it will cause more harm as compared to continuous smoking. So what is the vicious cycle and how to break it? As I've already told, an individual is having a mental illness, they start using tobacco as a mode of self-medication to relieve their symptoms. And they don't know that the tobacco usage itself is causing the worsening of the symptoms by exaggerating the symptoms. Secondly, they cause less bioavailability of the medications, hence overall contributing to the worsening of their complaints. And when the complaint worsens, their mental health status, it gets worsened. And once the mental health status is further worsened, it causes an increase in the stress amount, and that leads to the further increase in the consumption of the tobacco and tobacco products. So they get stuck up in this vicious cycle, and hence it causes further worsening of the underlying mental conditions. It attributes to the increased financial debts, it attributes to the increased physical comorbidities along with the psychological comorbidities, hence increasing the overall morbidity and mortality of an individual. So what are the clinical implications that we have to focus on? We have to identify the high risk population, especially those individuals with mental health issues. We have to identify them, especially like an individual with schizophrenia, an individual with bipolar affective disorders, which those who have a tendency to land up in this kind of situation of having an increased consumption of tobacco products. So we have to identify and screen them for tobacco usage. Then we have to impart the adequate medication or nicotine replacement therapies to them. We have to start on motivating them to quitting this behavior of tobacco consumption. And we have to prioritize the cessation program, tobacco cessation program, as an integral part of their recovery. So what are the strategies for intervention? The first and foremost important strategy is the integration of tobacco cessation in the various care models. So we have to collaborate with different departments, like recently the tobacco cessation clinics, they have been started in majority of the medical colleges, where multiple disciplinaries they are coming together, like community medicine is coming together, pulmonary medicine is coming together, ENT, dentistry, psychiatry. So it is a collaborative approach. Whosoever is getting an individual in their clinics, they are referring those individuals to tobacco cessation clinics, so that they can be motivated, they can be started on nicotine replacement therapy, they can be imparted adequate cognitive behavioral therapies, so that they can come out of this tobacco dependence. Then we should be focused on evidence-based medicines in the view of in the form of pharmacotherapies, like most majority of the individuals, they're not aware that whether the tobacco is a kind of disease or disorder and it can be treated. So we have to impart that knowledge as well, and they can be started on nicotine replacement therapies in the form of lozenges, gums, and there are various medications also available to prevent to treat tobacco dependence in the form of bupropion is there. Then recently the Indian market has been in Indian market, vernicillin has been introduced, which is a very effective drug for the treatment of tobacco dependence. Then behavioral therapies, they can be imparted in the form of CBT, then motivational interviewing, so that the individual can be motivated to quit tobacco. Then counseling of an individual they can be done in the form of either we can start with an individual level, or we can start with the anonymous groups as well, in the form of group therapy sessions, which can be done by integrating district tobacco cessation centers under National Tobacco Control Program. Then we have to follow individualized, tailored approach rather than just a prefixed approach. We have to understand the needs of a person. Then we have to devise the strategy how we can help this individual to come out of this tobacco dependence, and then only we can help them, rather than let's say that we have a regime that that if an individual is smoking 15 or 20 cigarettes per day, we have to give them 8 to 10 milligram of nicotine as a tobacco replacement therapy for let's say about for 4 to 6 weeks. Then we have to shift him on the uh, cognitive behavioral therapies. We have to train them regarding the various cessation methods. So this is not an individualized approach. This is basically a prefixed regime that we want to implement on all the individuals. So it might work, but it is not as effective as the individual approach, where we are going to cater the individual requirements. We don't know what kind of belief a particular individual is having regarding their tobacco usage. So in that way, we have to target this. Then regarding the community-based approach, we have to strengthen the existing programs like tobacco cessation control program. We have to do the training and capacity building. Not each and every individual with tobacco cessation can reach a tertiary care medical institute. Majority of them even don't approach the district hospitals. They don't even approach the PHCs and CHCs. So we have to create the awareness. For that, we need capacity building. We have to train the grassroots level workers, like the ASHA worker. They need to be trained about this thing. Once they are aware, only then they can spread the awareness that tobacco usage is a kind of a major health problem. It is the beginning of all the physical as well as the psychiatric morbidities. Then we can promote the National Tobacco Quit Line services. This is a hotline number where an individual can reach out to seek help regarding their tobacco issues. Then M cessation apps, they can be promoted and utilized for the same. So in the end, I would like to say that tobacco usage and mental health, they are like hand in hand, and they both go together, and they increases each other. So we have to tackle them simultaneously. Patients with mental health conditions, they are a higher priority group for tobacco cessation interventions as compared to the normal individuals. And all form of tobacco, whether smoked or smokeless, contribute to mental health burden. Quitting tobacco improves mental health outcomes and overall quality of life. It also helps in reducing the financial burden. It reduces the burden. Quality of life improvement is there, and overall uh, well-being of an individual is improved. So integrated evidence-based care, utilizing the existing models of National Tobacco Control Program, National Mental Health Program, and uh, the newer methods like this M cessation app, then hotline numbers, they can be used simultaneously for a wider reach, to create the awareness and to motivate individuals to seek help for tobacco cessation. Thank you.
What did it show? Only because of the environmental talent. Already we have school. But still, why the youth has started this? Just by having a stimulating effect of the dopamine. That is it. That is why the nicotine. But other way, what happened when if the student take the it will take a long time, then keep it double activation of the normal dopamine receptor. So this is the basic mechanism. Why the people have mental illness as well as the again I designed for the tobacco is increasing day by day. So why again I'm adding something why it is going on increasing day by day? Because for example, student an individual sitting in the class, he or she is having any stress. So what happens when a little stress is there? The next neighbor, any other sitting on by, he will say just take something, nothing will happen. So like this, it will increase day by day. And other factors, there are so many nowadays lifestyle is changing day by day. Our current lifestyle, especially in adults and adolescent period, it has changed a lot. First of all, I think I'm not wrong if I say nowadays people are using because of the just the status symbol, just in the with the peer threshold. Second thing, Dr. Jagati has told, media, because of media, relationship issues. Then the diet, even there are some study in that any individual is taking more soft drinks, even when he or she is having the habit of distilled tobacco. And another thing is that eating habits. Now fast food we are eating. So all these things are increasing. That is why this mental illness as well as substance abuse is also increasing day by day. So my message to all the society and all the students, all the youth, only one message: we can put all these things. Nothing is permanent in this world. Even we can go away from this. Only one thing. No doubt there are so many pharmacotherapy, psychotherapy, but in my opinion, only one motivation, desire to live. In case anybody has desire to live, he can. But we can help him with the psychotherapy, with the pharmacotherapy. Again, I thank you to Dr. Tanvi, very beautiful presentations by the Dr. Jagati and as well as the Dr. Uday. And at the last, I'm really happy by inviting me as a chairperson. Thank you, Dr. Uday, again.
I now request Dr. Deepshika for sharing a word.
Good morning, everyone. Very nice presentation. Thank you for enlightening us, Dr. Bharat. The relationship between tobacco and mental health is complex, definitely, and each influencing and exacerbating the other. And your data on 36 to 45% more tobacco use in the psychiatric patients is really alarming. That asks us to integrate. There is a need to integrate tobacco cessation strategies definitely into the mental health. Definitely, and healthcare professionals should be trained to address both tobacco use and mental health in a holistic manner. Definitely, there is need to break this vicious cycle that you have already told, tobacco and mental health. And integrated models are definitely very important. Alone, we can't. One department can't do this. And misconception about tobacco is definitely need to be cleared. Even our doctors, yesterday one of my interns said that we caught her with the cigarettes, and being an educated doctor intern, she was saying she was in stress, that's why she was taking up the cigarette. So even our doctors, they need to be, they are the actually idols, basically. They need to be told about this misconception. There is still misconception in spite of we are teaching them, and thank you so much. Thank you, Dr. Tanvi, for having me as a chairperson. Sorry, thank you.
Thank you, Deepshika ma'am. I now request Dr. Tanvi Sidhu to kindly come forward and felicitate our chairperson, Dr. Gurmeet Kaur. Our chairperson surely brought attention to the psychological battles the tobacco users face. Your inputs truly widen the lens of our understanding. Moving on, we have our third session that delves into one of the gravest consequences of tobacco use, the cancer. The title of the session is Tobacco as a Carcinogen and Insights for Prevention and Early Detection. The chairpersons for this session are Dr. Sanjeev Mahajan, who is a professor and head in the Department of Community Medicine at GMC Amritsar. He has over 20 years of experience in faculty at different positions in different medical colleges of Punjab. Along with this, he is a member of the State Operational Research Committee for RNTCP and NTE. He also worked as a nodal officer and was involved in surveillance activities, epidemic control activities, intersectoral coordination for different programs and diseases. Our next chairperson is Dr. Avneet Garg, who is present with us. He's an associate professor at AIMSR Bathinda. He has over more than 30 publications in various national and international PubMed index journals. He has received Inspiring Pulmonologist of India 2023 award by Economic Times. He is also one of the major authors of national guidelines for flexible bronchoscopy in India. Plus, he received American Thoracic Society scholarship for contribution in the field of pulmonary medicine. The speaker for today's session is Professor Dr. Rakesh Kakkad, who is Professor and Head at Community and Family Medicine Department at AIMS Bathinda. He is the editor of IAPSM's Textbook of Community Medicine. He is also the editor of Indian Journal of Community Medicine. He has over 87 publications and more than 11 chapters in various books. He has attended over 80 conferences and 23 oral papers. Dr. Kakkad will offer insights into tobacco as a carcinogen, highlighting early detection methods and preventive strategies that are essential for saving lives. Over to Dr. Kakkad.
Yeah, thanks. Just a minute.
You're visible, sir.
I am visible, but my presentation is not coming up. Yeah.
Sure. So if you wish, you can share the PPT with us. We
Yeah.
can track from our end.
I have already shared it with you. Please project it from your end.
Yes, sir, we'll start soon.
Yeah, hello. Am I audible, sir?
Yeah, you're audible.
I am so sorry. I could not just listen to the last suggestion that you put. Should I start now? Go ahead now. This is Dr. Vikrant Mohanty from Delhi, Maulana Azad.
Sir, Dr. Vikrant, sir, your session will be after this one. So
Okay. Fine. So I'll anyways be connected here. So you can just give me a call and maybe I'll join back.
Sure, sir.
Thank you so much.
Rakesh, sir, is the PPT visible to you?
Yeah. Make it a full screen, please.
Yes, sir.
Yeah. Thank you. So, sorry for the glitches, technical glitches. And I'm thankful to the organizer, especially Dr. Tanveer Madam and her team, for inviting me for this insightful session on tobacco control. So I'm thankful to our chairperson for this session. So the topic assigned to me is the tobacco as a carcinogen, insight for prevention and early detection. So we all are aware that tobacco is a major contributor for many of the cancers in our body. Now the presentation is not visible. Yeah. So again, please make it a big full screen. Yeah. So before going further, first we would like to, first previous slide, please. Previous, yeah. So it has a direct as well as indirect cost, and it has a huge economic cost, not only to the user, but also to the country. So it has a huge economic cost of 1% of GDP. And usually we usually discuss that it is, we are earning a lot of revenue from tobacco products. But for every 100 rupees earned through tax or other forms, we are losing 816 rupees through consumption of tobacco. So there's a loss for every 100 rupees, there is a loss of 716 rupees to us. So the direct cost is actually huge, not only economically, but also huge suffering to the our public through direct smoke as well as second and third hand smoke, and also a lot of suffering to the whole family. The smoking attributes around 74%, and smokeless form of tobacco contribute another 26%. So the smoking is the major form of tobacco use in India, and men's are accounted for 91% of this total economic burden, because usually men are contributing more towards the earning. So it is a major loss for the country. So out of total economic burden attributable to the tobacco, around 93% of this is through 35 to 69 years of age. And as per the recent ICMR study, 27% of the country's cancer burden is due to tobacco-related cancers. And with nearly 29% adult using tobacco product, India is the second largest consumer after the China. So next slide, please. Yeah. So tobacco kills up to half of its users. So the irony is that the users are buying the product themselves for their destruction, and around 8 million deaths are occurring due to tobacco-related causes, and 1.3 million are from the second-hand smoke. So we'll discuss second and third-hand smoke in next few slides. So regarding the global usage, around the prevalence globally is around 22.3%, while in India it is around 28.6%. And Majority of this is contributed by the men, that is 36.7%, and 7.8% by the women. And around 80% of the world population is from the low and middle income countries. So again, it is a big concern. In 2003, WHO member states have adopted a framework convention on tobacco control, and now 182 countries are its member, and they are following the norms as per the FCTC to a lesser or larger extent. And another strategy which is important is AIMSR strategy, which is suggested by the WHO FCTC group. And this AIMSR is regarding the monitoring of tobacco use and prevention policies regarding protecting people from tobacco smoke, offering help to quit tobacco use, and warn about the danger of tobacco, enforcing bans on its advertisement, promotion, and sponsorship, raising taxes on tobacco. Yeah, next, please. Next slide, please. Yeah, coming to a little bit about its epidemiology. So we have a prevalence of around 28.6% tobacco users in India. So males are contributing 42.4%, while females are contributing 14.2%. The majority of users are from 45 to 65 years of age, while the younger population, that is 25 to 44, is also contributing around 30%. It is the major burden is in the rural area, because most of the population lives in the rural area. So 32.5% is in the rural area. The population which is more literate are consuming less, while the less literate population is consuming more of the tobacco products. So we can see that the self-employed groups are more engaged in, if we'll see that occupation-wise usage. So self-employed people are more engaged in tobacco consumption. Even the students are also part of this group, and after retirement or unemployed also are contributing a significant proportion of its usage. If we'll see that GAT survey, the earlier GAT survey and the last GAT survey, so the results are encouraging. That is, the usage is decreasing. Tobacco users were earlier in the earlier survey, it was 34.6, now it is 28.6. Similarly, smokeless tobacco is also reducing, smokers are reducing. So the results are good, but since the population is increasing and people are now focusing more on the newer form of tobacco, so regulations are required. So rural people are consuming more as compared to the urban males or females, and average expenditure is also quite high per day. That is rupees 30 as compared to the rupees 12 in BD. Next, please. So around 28.6% of the Indian population is engaged, and India is second rank in terms of usage. Cigarette and BDs are the major form of tobacco used in India, and we are losing around 1% of the GDP due to tobacco usage. So this is the distribution of smoker across India by the age group. Next, please. So these are the different forms of tobacco which are being utilized in India. That is, smoking forms include the BD, cigarettes, cigars, cheroots, pipe, chillam, and hookah, while smokeless forms are gutka, khani, mawa, jarda, and snuff. So all these are the causes of various morbidities which are there in India. Next, please. We can see the state-wise distribution of tobacco usage amongst the working and non-working group. So the good thing is that Punjab is having comparatively lower proportion of its usage, while the northeastern states and the eastern states like Arunachal Pradesh, Nagaland, Manipur, Mizoram, Tripura, Meghalaya, and Assam, these are having more of its tobacco usage. And we can see that not working group is also consuming a significant proportion. So ultimately, this burden will be on the working group. And the other states like Odisha, Jharkhand, West Bengal, so mostly the eastern part of the India, they are consuming more tobacco. Next, please. Now, if we'll see the 8 major causes of morbidity, mortality in India, so 6 are attributable because of tobacco. So these important causes include the ischemic heart disease, cerebrovascular diseases, chronic obstructive pulmonary disease, and the cancers related to trachea, bronchus, or lung cancer. So related to the respiratory part of our body. Next, please. Now, this smoking is responsible not only for the cancers, but also for the other non-communicable diseases as well. So it causes around cancers of every organ like head and neck, lung. It can cause leukemia, cancer of stomach, kidney, pancreas, colon, bladder, and cervix. And on the other hand, it causes diseases due to the stroke, blindness, aortic rupture. So major cardiovascular diseases and lung diseases are involved. And the important thing here is that before the adulthood, the prefrontal cortex is underdeveloped, which is responsible for making important decisions. So making adolescent vulnerable to addiction. So most smokers become addicted to tobacco when they are too young to make informed choices. So by the time they realize, they are already in the trap of this cigarette smoking. Next, please. So these are the various ingredients of the tobacco, and around 400 chemicals are there in the tobacco smoke, and of which 69 are carcinogenic. And out of these 69, 15 are the major contributor for human suffering and for the carcinogenic effect. And a single cigarette contains around 2 milligram of nicotine, and it reaches the brain within 6 seconds of its consumption. So that's why it provides a kick, and that's why people are addicted to it. The person who smoke a lot of cigarette dies 7 years earlier from the person who doesn't smoke. So the smokeless form of tobacco is also contributing oral cavity, esophageal, stomach, and pancreatic cancers. And in Punjab, especially the esophageal cancers are very common. If we'll see the tobacco as a major cause of cancer, so esophageal cancer is common in both males and females, especially in males. Next, please. Now coming to second-hand smoke. So we have done one study on the second-hand smoke and its relation to the various diseases. So we have identified that the severity of COVID-19 is also related to second-hand smoke, in addition to the other carcinogenic effects of second-hand smoke. So second-hand smoke is a mixture of some smoke from burning end of cigarette and the smoke exhaled from the lungs of smoker. And it causes harmful effects in the general public and especially to children's. And its major impact is at home, that is around 52.3% of this is at the side effects is at home settings, and 29% is at public places. Next, please. Then the third hand smoke, that is as per the recent studies, the residue from the tobacco smoke that clings virtually to the surfaces long after the BD or cigarette or other form of tobacco usage. And this is again a big threat to the children and to the other family members who are actually not smoker. There's another term, that is the fourth hand smoke, which is the lingering residue of the tobacco smoke that persists on surfaces even after the smoking has stopped. This is as per the Lippincott. Next, please. So tobacco, for early identification of this carcinogens, there are biomarkers which are mostly detected through urine, blood, saliva, or expired air. So this sample can measure the tobacco used as a carcinogen biomarker, and mostly these are DNA adducts, that is the byproduct, protein adducts, and the blood or urine metabolites of tobacco used as a biomarker. The DNA index measurement is most direct evidence concerning the extent of DNA damage in a person who used tobacco product. Next, please. And there's another interesting finding, that is this nicotine is metabolized to cotinine. And recently we have conducted a multicentric study on the BD rollers in India, in 6 states of India. And we also have measured this cotinine level amongst the users as well as amongst the non-users. And this cotinine further breaks down into trans-3-hydroxycotinine, which is catalyzed by the liver. And this ratio of 3-HC to the cotinine is very important, which can be detected in the plasma or saliva. And the clinical trial has shown that higher the level, this ratio, that is 3-HC to cotinine, lesser are the chances of its quitting. So the likelihood of quitting decreases as the ratio increases. So it is related to the quitting habit of tobacco. Next, please. So we can see that even after many laws are there regarding the warning signals on the tobacco products, pictorial warning signals, and this cigarette is still being available in the near the schools and colleges. So strict laws are required to control it. Next, please. So now regarding the certain strategies which we are adopting. So in certain quotes like, if we lose the battle against tobacco, we will lose the war against cancer. And another quote by the Mark Twain, that is, giving up smoking is the easiest thing in the world. And I know because I have done it thousands of times. So it is very difficult actually to stop, and strong social support and counseling is required. Next, please. So these are the certain rules suggested by the enforcement as per the FCTC or the Indian government has adopted. That is, it refers to measures to restrict or prohibit the use of logos, colors, and brand images or the promotional information on packaging. So now every such product is having a pictorial warning, while according to this law, and we have to discourage the usage of attractive colors, which is related to this year's theme. That is, we have to discourage the attractive tactics of the social marketing done by these industrialists for promoting these products. So also it also been described as a packaging that is the black and white or two other contrasting color can be used. Next, please. Now these are the certain key measures which are suggested as per the FCTC law. That is, continuous surveillance and monitoring is required to know the exact burden of tobacco control initiatives. So around 50% of the global population is covered by the National Tobacco Use Surveys. And we have to focus also on the second-hand smoke. There's no safe limit or the concentration suggested for the second-hand smoke exposure. While the second-hand smoke causes heart disease, lung cancers, respiratory illnesses, and it affects many other form of morbidities. So around 1.3 million people are affected by it annually, and 74 countries have comprehensive smoke-free laws for second-hand smoke also. Next is the supporting quitting efforts. So in India, many such initiatives are in place. Even ministry has recently advocated to have a anti-tobacco or the for quitting these habits clinics are established in nearly all the colleges. Next, please. So pictorial warning and media campaign is also important part of this campaign. That is, 103 countries meet best practices for pictorial warning. That is, more than 50% of the packaging area should portray this pictorial warning. There is a ban on advertising and sponsorship, and 66 countries have complete TAPS ban. This raising tobacco taxes is also a very important measure. That is, 10% prices increase cuts consumption by 4 to 5%. So most cost-effective method is to reduce the uses by raising the taxes. So on at present, only 41 countries have taxes, which is more than 75% of retail price. Next, please. Now, the major policy level changes are required for eliminating illicit tobacco trade. That is, one of the 10 tobacco products consumed globally is illicit. So stringent laws and political commitment is required for decreasing this illicit trade. And the focus is also required for regulating the newer tobacco products. That is heated tobacco products and e-cigarette, which is not risk-free. It again also causes many of the morbidities. And these nicotine pouches often are marketed as tobacco-free, but still these again cause addiction. So a strict monitoring is required even for usage of such pouches. Next, please. So this is the theme of this year's World No Tobacco Day, that is bright product, dark intentions, and unmasked appeal. So industries are using various gimmicks for promoting their product among the youth. So we have to raise awareness. So I'm thankful to the organizer for organizing such a wonderful initiative for this quitting smoking. So thanks from my side.
Thank you, sir. Thank you for the evidence-rich section. To unpack the layers of this heavy yet crucial topic, I now invite our eminent chairpersons, Dr. Sanjeev Mahajan, who is available online, and Dr. Neetwar, who is present here with us, to lend their thoughts and enrich this session with their vast expertise. Over to Neet, sir.
Thank you. Thanks to the organizers for inviting me as a chairperson, and thanks to Dr. Akesh Kakkar for very insightful presentation. And I will really like to appreciate the facts which you have brought in to light. That for every 100 rupees of taxation revenue, country has to spend more than 800 rupees to control the damage caused by the tax. In the past, I have attended different meetings at the state level regarding cancer prevention. And I used to say that alcohol and tobacco production or sale should be banned. And most of the bureaucrats used to say that the government will not run without its taxation or revenues. But if in return we are to spend 8 times money, then what is the fun of getting taxation from the wrong means?
Yeah.
So I think that the government should think on these lines, and rather than generating revenues from the products which are causing more damage to the youth, to the country, to the productivity, they should generate some other means. Thank you, sir. Thank you. Next speaker, please. Next chairperson, please.
Thank you, sir, for such a crisp and informative talk. So, as a pulmonologist, we are primarily concerned about the lung cancer because smoking remains a major cause for the lung cancer, and the prevention part has been discussed already in detail. So, we will have some words about the early detection. Why we want to detect the case of lung cancer? Because we did a study in that considered more than 2,000 patients, and that is the largest study till date. And what we found that more than 95% of the patients do present in stage 4 cancer. So there is a concern to detect early. So how we do it? The international guidance say that if somebody has a smoking dex of more than 20 pack years and age is more than 50, and patient hasn't took the cigarette for last 15 years, then you need to go for low dose CT scan to detect the early cancer. But in India, that is so costly that it can't be implemented at a community level. So we have modified a little. What we do in our OPD, the patients who come with a diagnosis of COPD, the one who has a biomarker school for more than 20 years, or who just fulfill the criteria of a smoking death of more than 20 pack years, we do encourage the patients to go for low dose CT scan. So if there is any cancer, we can detect it early, or accordingly treatment can be done. So great.
Thank you to our chairpersons. Now,
Ma'am, I want to mention one point here, that as Dr. Akesh has said that most of the times addictions start in the adolescent stage, but the mind and brain of adolescent is not mature enough to take decision right regarding what is right, what is wrong. So more of the effort should be directed towards the school children or youth in the adolescent age. And all the best efforts must be done that all the sale of tobacco related products near the school and colleges should be strictly banned, and they should be punished strictly so that we can save our youth, we can save our country. Thank you.
Thank you, sir. Very rightly said. I now request Dr. Tanveer ma'am to kindly come forward and felicitate the chairpersons. A big thank you to our chairpersons for their balanced, evidence-based inputs. Your reflections help tie together prevention, early detection, and the road ahead. Thank you once again to the chairpersons and the speaker. We now move on to our next session. The title of this session is Tobacco's Toll on Oral Health, Early Detection and Intervention. The chairpersons for this session are Dr. Riddhi Naram, who is a professor and head at the Department of Public Health Dentistry, AIMSR Bathinda. She has a PG diploma in clinical research and medical legal systems from Symbiosis, Pune. She also has over 70 publications and currently is an associate editor of JIA PhD. Our second chairperson is Dr. Darshan Goyal, who is a professor and head in the Department of ENT at AIMSR Bathinda, currently serving as professor and head and has dedicated and accomplished ENT specialist with over 20 years of experience in teaching graduate and postgraduate medical students. Our speaker for this session is Dr. Vikrant Ranjan Mohanty, who is a professor and head of department at Maulana Azad Institute of Dental Sciences, Delhi. He's a recipient of the IGDC scholarship and completed his Global Tobacco Control Certificate program at the Johns Hopkins Bloomberg School of Public Health in 2019. He has 87 in national and international publications in reputed journals and over 352 national and international presentations. Now, I request Dr. Mohanty to kindly shed light on the topic. Over to Dr. Mohanty.
Thank you so much. I hope I'm audible to all of you.
Yes, sir.
Yeah. 1 second. Okay. So at the outset, I would like to thank the Adesh Institute of Medical Sciences, the principal sir, the head of the Department of Community Medicine, the Medical Education Department, Tanveer ma'am, and all the faculty who have been a part of this, tremendous celebration of efforts that that everyone is taking towards the World No Tobacco Day. So I hope the screen is visible to all. Yeah, Riddhi, and I also like to thank my colleague, dear colleague, Dr. Riddhi, for supporting and guiding me through this. And she's been a dear friend for many years. So with this few words, let me just start today's presentation. I think the previous speakers would have already told you about the importance of World No Tobacco Day and how every year the World Health Organization has been working towards sensitizing masses, sensitizing different age groups regarding the various tobacco industry tactics. And this year's theme is focuses on exposing lies, protecting lives, unmask the appeal of tobacco and nicotine products. So it's very important that we talk about this because what exactly is happening is the industry in almost, I would say, next slide, please. Can you just take the next slide? Next slide. Yeah. So this is very important for all of us to look at. I think the burden also has been discussed, but more importantly, I will not talk about this slide. This slide is for all of you to view it. But let me tell you something that every day, nearly 3,700 people per day are dying. Almost 13.5 lakh people annually are dying in our country alone when it comes to tobacco use, whether it is directly or indirectly. So when these are alarming statistics, these are figures which talk about how tobacco impacts not only the development of a country, not only the health of a country, but also families, and the social impact is much more deeper than we can think of. These are just numbers. But if I say tobacco, the death related due to tobacco directly or indirectly affects the development of a country, that means India has a demographic dividend wherein huge youth is actually there, and that is our strength today. And that if it falls prey to tobacco industry tactics, then it is dooms for all of us, and we are bound to fail in many quarters because of this addiction, which is so severe and so alarming. Next slide, please. So I think most of you have been told about the GATT survey, the Global Adult Tobacco Survey. We've already done 2 rounds. This is a global, internationally acceptable, standardized methodology through which we actually, we actually assess the different types of tobacco use, its burden, its impact, and different aspects in terms of tobacco control, cessation services. It's a comprehensive assessment of tobacco per se, as well as its impact, as well as its services that are being provided. So this survey, the last survey was done almost 9 to 10 years back, and this survey gave us important figures that almost 1/3 of the Indian population then has been exposed to some form of tobacco. That means every third, 1/3 of the population. That means we have currently 266.5 million people who are consuming some form of tobacco. It is alarming. It's very important that we also look at further. This figure needs to be broken down further, though it is not a part of this presentation. But still, I tell you that it is important to break these figures down and look at how exactly these numbers are. Next slide, please. So when we talk about this, numbers, we should also talk about the various forms of tobacco. And I'm very sure that the previous speakers would have spoken about this in detail, mainly in terms of understanding. See, we have to understand something more detailed. Don't just look at these figures. Look at who is the consumer of these kind of products. If you look at cigarettes, who are the consumer? What age group is the consumer? If you talk about canny, which socioeconomic strata, which education level is the one which is exposed to such form of tobacco use? If you're talking about hookah, we should understand where it is culturally rooted and where it is accepted in urban areas. So we have to understand these products. Everybody knows, everybody understands the prevalence and all these things, but we should now start looking much more deeper. Tobacco dentifrice on the right hand side you can see is Gul Manjan. Again, a very important, because we are dental professionals, Riddhi will understand that better, that tobacco, this Gul Manjan, is not only addictive but also abrasive and results in a lot of dental manifestations other than its tobacco impact. And people have been unknowingly using it, thinking that it is good for their teeth, it reduces pain, it reduces gum bleeding and all that, and strengthens their gum. Many people talk that it strengthens our gums. So these are things which are myths. These are things which are issues concerning to the tobacco products. We have to look deeper into this. We have to look at the social context of tobacco use. We have to look at the behavioral context of tobacco use. We have to look at the psychological context of tobacco use. We have to understand the environmental context in which tobacco and these products. Again, I think a recent study, I will not be able to give the exact figures, but these cigarette butts are a huge problem when it comes to environmental waste. So any colony, if you go in Delhi, any society, any building, you will see that the packets, sachets of these tobacco products are strewn all over the place. Even outside my house, down the stairs, if I go down, I will see every day morning, I will see one packet fallen somewhere or the other here. So that is the kind of waste that is generated due to this tobacco industry. Again, this is a point of that we have to understand. I am just going to touch upon a few points which will allow us to understand, other than the oral things, oral conditions and concerns, which I am supposed to focus. Being a proponent of this and working in this area of tobacco cessation for the last 15 years nearly now, I understand that it is just not tobacco cessation, because we have to look at it at comprehensively, how it impacts other aspects also. Next slide, please. So this is another picture, a very important picture. It talks about many things, but it gives a very uniform and a straightforward message. The topic, the title, as it says, is a common risk factor. What is more important is that we understand that there are multiple risk factors, and these risk factors are responsible for multiple non-communicable diseases. When we talk about non-communicable diseases, sometimes we need to weigh these risk factors in terms of understanding how it causes, as in how it affects the different age groups, the different lifestyles, and all those aspects. If you look at smoking on the right hand side, top highlighted in the red, you can see that smoking is responsible for cancer, smoking is responsible for respiratory disease, smoking is responsible for also periodontal disease. So if you further look into cancers, there are almost 12 to 16 types of cancers which smoking is directly or indirectly responsible. Smoking is responsible for heart disease. Again, there are multiple things that it is responsible. So tobacco use directly or indirectly is a common risk factor for multiple non-communicable diseases. Again, a thought to keep in your mind, because whenever you're involved in counseling, whether you're a medical student or a physician or a internal medicine or a community medicine or a dental professional, you have to keep in mind that you have to comprehensively inform the patient about its ill effects, even though they know about it. There are some things which they will not. If you just we finished a awareness campaign just 10 minutes ago, and the first thing that we asked people was, what do you think tobacco causes? Each and every one only spell out cancer. But have they ever seen what cancer is? Do they know the amount of damage that it causes? No one is able to even understand those details. So it is important for us as healthcare professionals that we not only use do not use much of fear tactics, but also try to make them understand in a very simple language so that they're able to comprehend that this risk factor is not only responsible for dental problems or oral cancer, but multiple other problems. Next slide, please. This slide is a very simple slide, talks about very simple aspects of oral manifestations. And knowingly, I have, this was a part of one of the health education materials that we just prepared yesterday. And I had to quickly take crop it out for a better understanding. And the clear message has to go to all of you that tobacco use, whether it is smokeless, and let me tell you, India has a more prevalence of smokeless tobacco today. Almost 21% of the people consume, 21% is tobacco, smokeless tobacco, and the other is smokeless smoke form, or also we have mixed users. So smokeless tobacco has become a big problem. It also shows that tobacco control has done effectively in terms of cigarettes and other products, smoke products, because they are regulated. But then that resulted in more unregulated smokeless tobacco form, and because of its accessibility, because of its cheap, availability, as well as it does not cause a discomfort to public, whereas smoking would have. So as a result of which many people have switched over to smokeless tobacco. And so first thing that you can see is bad breath. So tobacco users are actually, they normally take it as a mouth freshener, but then slowly, because it starts affecting the gums, it starts affecting the periodontium, which is the bone which supports the gums and the teeth. It starts affecting them, and because of that, these the microorganisms result in malodor, and this oral malodor results in you having this bad breath. Then you can see the second picture is about the staining. Staining is a very common manifestation of cigarette smokers as well as smokeless tobacco users. Then you can see that there is smokers melanosis, what we call. It is again blackening or pigmentation of the gingiva or the gums, resulting in blackish discoloration of the gums. Then severe forms of tobacco is affected over the times. Over this whole period results in periodontal disease, which is a severe form of gum disease where the teeth start becoming loose and they might even fall off. Then we see on the left hand side, lower side, we see the smoker's palate. Again, a manifestation of the minor salivary glands. They get traumatized due to the excessive chemical as well as heat, and as a result of which you can see an altered surface of the skin on the palate. And this is again smoker's palate, it is called. And then you can see a most common finding of smokeless tobacco users is this I would say this smokers, it is called the quid keratosis, the buccal mucosa or the gingival sulcus between the gums and the buccal mucosa is where we see this form. That is where the quid is kept, and that is where continuously this substance erodes the smooth buccal mucosa or the gingiva or the oral epithelium, and resulting in such a keratotic appearance. And that is the next manifestation that we see. Then you can see that there's a scale which has been put where the patient has a reduced mouth opening, which is normally defined as oral submucous fibrosis, where excessive use of smokeless tobacco products result in fibrosis and difficulty in mouth opening, and as a result of which the mouth opening is reduced. Normally, it is three fingers in opening is there, but as the fibrosis increases because of the chemicals from the smokeless tobacco use, it results in fibrosis of these products. One second, please. Okay, So next slide, please. And moving on to the oral potentially malignant disorders. So this is a group of diseases with disorders which come together, and they start from simple white patches which are called as leukoplakia. Again, those same white patches can turn red, and they are with a almost similar kind of etiology, result in erythroplakia. Then there are other tongue manifestations. Then you can see tobacco quid keratosis, which I was talking about, and smoker's palate, which I've talked about. And this keratosis can also, or smoker's palate can be further superimposed with fungal infection because of immunocompromised conditions, or else even tobacco users generally have a poor immune response as compared to a generally healthy person. Next slide, please. So we are very much aware that tobacco use has a lot of damage to the oral cavity, because that is the gateway to your overall, to the whole body. But we also need to understand the implications, and I'm very sure that the other speakers would talk about the implications in terms of health, in terms of patients undergoing, diabetic patients undergoing treatment, remaining tobacco users have a very difficult diabetic control, because most of the time the peripheral blood sugars are raised in terms of tobacco users because of the type of substance they consume. Then the cardiovascular issues, the respiratory issues, we are very well aware. TB and tobacco go hand in hand. There is no second thought of it. One of the findings that we had seen in one of our cases was that many of these patients visiting chest clinic switch over to smokeless form if they were smoking BD and the doctor has told them not to smoke. What they do is, during the period of 6 months, 9 months of TB treatment, they switch over into smokeless tobacco use. Next slide, please. So these are a few things that you have to keep in mind as we talk about tobacco and its impact. As our role as healthcare professionals, our role always remains in early detection. Whether it is health worker, whether it is a physician, whether it is a dental professional, whether it is a specialist, all of us are involved in very simple things. The first thing is to detect it early, because early detection will allow us to treat the disease even before it manifests further. So there are different techniques. We all need to learn these basic methods of early detection. We know that there are three most common cancers which our country is fighting today. It is the breast cancer, the cervix cancer, and the oral cancer. In which oral cancer, let me tell you, ladies and gentlemen, is the most easily accessible area and can be visualized without any kind of, other than being trained, you can very easily diagnose as well as identify it if you do a thorough examination. Similarly for other cancers, but then they require some separate space and obviously proper privacy for undergoing those kind of tests and examinations. But oral examinations can be done easily in any place which is appropriate for dental examination. Also, it is our moral as well as obligation as a healthcare professional to engage in patient education. We might think it does not allow us or does not patients are not looking for health education, but they're looking for the right kind of information today. With the heave with the kind of information so freely available on internet, it becomes very difficult for anyone to actually judge the quality of information. So it is important that we promote quality as well as standardized information to all our patients. Again, creating healthier alternatives and providing them solutions for, in case a tobacco user is there, what they can do when they quit, when it comes to healthy lifestyle, and obviously motivating them. So these are a few things as healthcare professionals we have to keep in mind. Next slide, please. So you can start with simple. This is a very simple slide, picture on the left hand side, which talks about the basic steps of self oral examination. This is something which doesn't matter from which profession you are, doesn't matter whether you're a healthcare professional. It matters that we all propagate this. A school teacher also can teach this. A health worker also can teach this. A dentist also can teach this, and a doctor also can teach. So we need to just this simple 8 steps of self-examination and reporting in case of any deviation is the first step towards early detection. So propagating this in your communities is one of the most simplest and cost-effective strategies that you can do. Next, professional screening. Then you can refer in case if a patient complains of an ulcer which is not healing for more than 2 to 3 weeks, increasing in size, a lump is increasing in size, any such altered manifestation which is increasing in size or is not healing needs a proper thorough checkup. So dental examination can be done. There are dental specialists who actually do this kind of examination. Biopsies are taken, and pathologists, oral pathologists are there who will diagnose this and provide detailed information. Then there are some advanced tools I'll talk about. Next slide, please. There are certain advanced tools that we use. Multiple, all these tools. I'm not going to details of this. Some of them are either they are like toluidine blue. Is that toluidine blue is basically a vital stain, can be used in screening in communities, though its specificity sensitivity is a little bit lower side, but it is still a good motivational tool as well as a good indicator for patients so that they understand the importance of oral examination and precancerous conditions, and then reporting. And also during many times surgeons use a dye for margins and try to see that this, so we have to understand that using all this is a cost effective strategy. We don't need expensive equipment. These things can be made available in many settings. So it is important we start using them and coming out with more and more outcomes rather than just thinking that this is not an effective tool. Then we have a light-based well scope is there. There are many tools or light-based tools are there which can be used. Nicotine test, again, they're a little bit expensive, but this nicotine test will have biomarkers, biopsy, and all these things can be done. But this is a complete package of various early detection tools which dental professionals as well as other professionals can do. Next slide, please. This is something which we normally talk, and these are guidelines based on the what NMC has given in terms of operational guidelines towards setting up tobacco cessation clinics in medical colleges. Frankly speaking, we started this effort way back in 2018 with dental colleges. More than 250 dental colleges then started off adopting this practice and implementing tobacco cessation clinics. And we have been instrumental, and currently the National Resource Center of Oral Health and Tobacco Cessation, which I am taking care of along with my team, is now trying to standardize all these equipments, availability of equipments, everything as a part of the process that we are working on. So these are simple equipments. Yes, some of them, like for carbon monoxide monitor, would cost somewhere between 50 to 60,000. A well scope is even more expensive, but it's an optional device. It can cost between 5 to 7 lakhs. But if your institution has the capacity of buying them, please go ahead and do this. Otherwise, a weighing machine, a BP apparatus, a basic tools for examination, all these can be made available in all the tobacco cessation clinics. Next slide, please. Quickly looking into the overview of cessation strategies, which the other speakers would talk. We as healthcare professionals can intervene through behavior methods as well as pharmacotherapy. There are very brief advice. It doesn't mean that you have a busy OPD and you can't take so much time out to guide your patients. But a 30-second advice, which is good for the patient, can be slipped in while you're counseling your patient, telling him about his underlying medical condition or dental condition. So 2A are, that is ask, advise, refer, or 3A, ask, advise, act. The other techniques of brief advice, which will take at least 15 or 20 minutes or half an hour, depends on, first you need to get trained properly. There are 5 A's, 5R techniques, frames techniques. These are all motivational interviewing or behavioral techniques which are used for shifting a patient and changing his behavior from addiction to staying quit. There's a lot of drugs available which are NRTs, the nicotine replacement therapy. Nicotine gums, patches, and lozenges are available currently in our country. They come with specific doses which are legally approved. Please also see that these products are taken from standard pharmaceutical companies, because the tobacco industry is also involved in producing these gums and lozenges. So we need to see that we don't allow the tobacco industry using these opportunity of even being on one side trying to propagate cigarettes and on the other side trying to sell even NRTs. So, and otherwise non-NRTs, we have bupropion and varenicline. That's something which we have to keep in mind. Next slide, please. So these are all things available. We need to get trained properly towards this, systematically approach your patients, start from health education, awareness, then a proper referral channel builds. Then once the patient walks into the cessation clinic, then engage your patients in a systematic manner, like what is written here, the 5A technique: ask, advise, assist, assess, and arrange. It's a very systematic acronym which can be done very simply by each and every one who is trained properly. There are multiple training options available. NIMHANS Bangalore gives an online, primer course. Many of you who are interested can take up this program. Next slide, please. One thing which is way less discussed is the withdrawal symptoms. Let me tell you, one of the very famous quotes of Mark Twain. He said that quitting cigarette is very easy. I have done it more than 1,000 times. So when he says something like this, it means a lot. That means cigarette or nicotine is so addictive that every now and then you come back into the loop. and you get involved, drawn back into this whole addiction cycle. So it is important that we understand that withdrawal symptom is a common manifestation of nicotine de-addiction, and it is important that we address this. As healthcare professionals, we should be aware that the withdrawal will happen. There is a time period with which withdrawal happens. All manifestations do not happen in each patient, but it is important that we have simple solutions which the patient can actually use during his day-to-day life, whether it's drinking, sipping water, deep breathing exercise, delaying his urge, distracting himself, discussing with family and friends, improvising his diet, and taking medicines as or when it is required. So these are things, next slide please, which are very important that we have to be aware ourselves and also understand that the patient needs to communicate it. When it comes to dental treatment outcomes, tobacco has been a very, again, its addiction is a different problem, but dental treatment outcomes are also affected because of tobacco use. Today's mode of treatment is dental implants. Everybody is talking about dental implants, but let me tell you one thing, that dental implant failure, one of the most important and the biggest reason for dental implant failure is use of tobacco, whether it's smoke form or smokeless form. So people don't understand this, that their habits not only cause them financial loss in general, but also dental treatment loss is also there. Patients who undergo extractions, if they consume tobacco after extraction, there can be chances of dry socket. There could be, for example, aesthetic restorations can also get damaged or also get discolored because of tobacco use. So it is important that we understand that this kind of manifestation is also there. And similarly, I'm sure on the medical side, healing and wound healing is delayed in cases of tobacco use also. Next slide, please. So we should be involved in multiple campaigns. There are, like what we are doing today, we are building capacity. We need to, like I think Sir Dr. Mahajan was just saying towards the end of the previous session, that we need to target the adolescent, we need to target the school going children. It is important that we engage in different ways, which they feel interested in. So having mass media campaigns, outreach programs, cancer awareness, walkathons, marathons, and cyclothons, and multiple ways we can think of, whatever is based on our, whether we, even if a dental college can do it, medical college can do it, anyone, we should also work. You have a huge, Adesh has a very good campus and a beautiful campus. And I know that the campus is tobacco free, but we still need to see that outside the campus also, we need to work towards, with the proper stakeholders, we need to work towards making it completely tobacco free. We need to see to it that we comply with the TOFI guidelines, the tobacco free education guidelines, and we should do a regular checks of that. And that is something which we can contribute in the state level policy also, by propagating that we have been doing regularly this, and this leadership from Adesh can go a long way. Next slide, please. So this is one more thing which I would like to say, and integration. We talk about a lot of horizontal integration, vertical integration, and new types of integration. So this is another type of integration should happen, where dental professionals, medical professionals, oncology experts all need to come together, work at different levels, and see that when an oncologist is treating a patient with oral cancer, a dentist can contribute in that. When dentist is out in the community doing it, an oncologist can also contribute in that. So multiple ways we need to look at integrating and creating linkages and referrals. Next slide, please. So to conclude, I would say that, see, early detection is one of the important, I would say, pillars of disease prevention. And when we talk about early prevention, we talk about screening, we talk about timely diagnosis, we talk about reducing the time that is lost, in terms of the patient being identified and the patient being treated. That is where the delay happens. Many of these patients don't turn up to hospitals in time, resulting in delay, or that there's a huge lag period between the diagnosis to the treatment. So that kind of linkages need to be strengthened, and this kind of coordination between dental professionals, medical professional colleagues, and oncology teams has to be there, because if they all come together and try to understand this pattern through which they are actually taking up each responsibility and trying to bridge that gap, that is when the ultimate benefit will reach the best patient. Dental professionals are leaders like all healthcare professionals. Each one of us takes up multiple roles, whether as an academician, whether as a policy, as a leader, whether as an alliance builder, whether as a role model, whether as a health educator. We need to understand that all these roles are to be done by each one of us, and without this this whole effort of bringing down a tobacco burden in our country is impossible. Next slide, please. So I would like to thank you all for your patient hearing, and I think I would have just exceeded the time by 5 minutes. Thank you so much for your patient hearing. And in case if there are any questions, I'm most welcome to answer them.
Thank you, Dr. Mandi. Let us now turn to our expert chairpersons, Dr. Riddhi Narang and Dr. Darshan Goyal, for the clinical wisdom and broaden our understanding of public health and dental care perspectives.
Thank you, Dr. Mandi, for this nice presentation, and especially the photographs of every reason you have covered in this topic. But our ENT point of view, I just want to add one more thing. We often see patients of tobacco smoking as change of voice. In that case, the people who smoke, they need video laryngoscopy examination of the larynx. And one more thing, before it advances to the CA of any part of like larynx or lungs, the patient usually starts dealing with the symptoms like dry nose, dry mouth, or irritating cough. It starts within few months of starting this smoking. So thank you, and thank you, Dr. Tanveer, for inviting me as chairperson.
Good afternoon. It's a privilege for me to chair this session. Knowing sir from last 12 years, he has been actively working in this field. I would like to tell you all that MAIDS is actually a resource center for tobacco cessation. They have been actively working on this with a lot of efforts on capacity building and the resources, the IEC material. Every 3 months or quarterly, they call dental specialists from across the nation, and there's a session for 2-3 days where they teach us and tell us about how to go with the counseling procedures. Even Adesh has participated in the last session. Thank you so much, sir, for all the efforts. We are all following your footsteps. And dental fraternity is actually thankful because he was the one who has actually started this tobacco thing in India. Thank you, sir.
It's so kind of you to say something like that. But I think one man can't be enough. We need a team. And if, and Rome was never built on a day, as they say. So if we really want to make this country tobacco, we have to, I know there are multiple ways that we have to work on. There are multiple ways we have to link with our, like how sir was talking about, we need to link even dental students and professionals need to be trained to understand what sir was saying. And similarly, the medical fraternity also needs to understand what the dentists are saying. And in such a collaborative manner only we will move ahead. Just one thing I would like to add here, that Adesh Institute of Dental Sciences was one of the first 5 top tobacco cessation clinics, which when we did in 2020, the first situation analysis report was presented to Government of India. The work of Adesh Institute of Dental Sciences, Dr. Riddhi and the whole team, their work was presented as one of the 2 dental colleges from the private sector because of their commitment and effort, and I would congratulate her for all the efforts. And I'm sure we are coming up with the second wave of situation analysis in a very short time. And I hope Adesh again, stands high and leads the way forward for everyone to follow. So best wishes to you, Dr. Riddhi, and thank you so much, Dr. Tanveer ma'am, for this invite. And I'm really honored to be a part of this whole team.
Thank you, sir. Thank you, ma'am. I now request Dr. Tanveer ma'am and Dr. Varun sir kindly come forward and felicitate the chairpersons. Thank you to your chairpersons and speaker. Your emphasis on early detection and timely intervention truly highlights the critical role dentists and clinicians play in the fight against tobacco-related diseases. Thank you once again.
I have also told Riddhi that it was 11 to 12 chai ka time tha, so when I meet her next time, the tea and the snacks are due from their side.
We now come to the final session of the day focused on legal frameworks and tobacco control. The title of this session is Guardians of Health, Implementing Code Path for a Tobacco-Free Nation. The chairpersons for this session are Dr. Anu Bharadwaj, who is a professor in the Department of Community Medicine at AIMS Mohali, and Dr. Rupali Verma Bagga, who is a professor and head in the Department of Community Medicine at CMC Ludhiana. The speaker for today's session is Dr. Pranjal Sharma, who is assistant professor in the Department of Community Medicine at DMCH Ludhiana. Dr. Pranjal Sharma is the nodal officer of Hoshiarpur for verification of subnational claims for progress towards TB-free status in India, and he has received appreciation certificate awarded by Deputy Commissioner Ludhiana for management of COVID-19 pandemic in Ludhiana district. Our chairperson, Dr. Rupali Verma Bagga, is the professor and head at AIMSR Medical College and Hospital, Rajpura. Our second chairperson, Dr. Anu Bharadwaj, is a guide and has guided and co-guided more than 15 MD theses. She is also co-PI in various ICMR funded research projects and has contributed to Elsevier's textbook of community medicine. She is also the vice president of SCEHAT Mohali, which is the Society for Community Empowerment, Health Promotion and Translational Research. Dr. Pranjal Sharma will discuss the implementation of CODPA and how healthcare professionals can be true guardians of health in enforcing the critical legislation. Over to Dr. Pranjal Sharma. Dr. Pranjal.
Am I audible to all?
Yes, sir.
Okay, very good afternoon, everyone. And I would like to thank the organizers for giving me the opportunity, for speaking on this very important topic. And fortunately, most of the things have been covered by previous speakers, so they have made my work quite easy. So I will try to press upon the important points according to the topic. So let's start with the basic introduction of how tobacco industry is using various aspects for increasing their revenue and targeting our adolescent age group as well. So as far as agent is concerned, we have not just smoke or smokeless tobacco. Now the vape is also coming in fashion, and even adolescents are being targeted with this. As far as vector is concerned, so tobacco industry in recent past years, it has been seen that their revenue has gone up, and that is only due to that they have they have come up with a new form of tobacco. As far as environment is concerned, so we have legislation in place and physical surrounding per se, you can say public smoking has been discouraged in our country at very high level, and it has been going very well. But as far as implementation of legislation is concerned, so there is some lacking in that, and we'll be sharing that in the subsequent slides. As far as host is concerned, there is not even a single age group that is not being targeted by tobacco industry. So just have an overview about ITC, which is Imperial Tobacco Company. If we look at the trends here, since let's focus on the FMCG cigarettes section. So from March 18 to 20, we can see the revenue almost was stagnant. So from 21 to 23, it rose from 22,000 crore approximately to 28,000 crore. So it's a skyrocketing increase in the selling of cigarettes. And even if you look at agribusiness as well, it went up from 8,000 crores to 18,000 crore. And although the tobacco industry does say that they are revolutionizing the agriculture of wheat and all, but that is all a hoax. The basic income from agribusiness is through tobacco cultivation. So we can see there is stark increase in the revenue from 21 to 23, and I'm not sure about the figure of 24, year 24 and 25, but I'm sure that would be going up as well. So let's see, although the GAT survey was covered by previous two speakers, so I'll just focus on one thing. So this GATS2 survey was done in 2016-17, which is almost a decade back. And if you will see the prevalence of the knowledge about electronic cigarettes was maximum in the age group of 15 to 24, and it was around 3.9%. So this is a very important finding here, which gave us some sign a decade back that something is not right. Even if you look at the other age groups, the knowledge was not that good in comparison to the age group of like 15 to 24. And all these age groups are basically students. They're adolescents and even college going students. And prevalence was only 0.02%. So we may say that, okay, it's not a big deal, like back in like a decade back. But if we dial our clock forward, so the GYTS survey, which is Global Youth Tobacco Survey 4, its report came in 2019, and only school-going children were part of the survey. And you can see the e-cigarette prevalence is 2.8%. So in 2016, the 15 to 24 year age group was at 0.02 prevalence, but in 13 to 15 of years of age group in 2019, the prevalence went up till 2.8%, and that is a stark difference as far as usage of e-cigarettes is concerned. And we say that our country is a young nation, like because around 24 crore people lie in the age group of 15 to 24. So we can see that the revenue which has increased as far as tobacco companies are concerned, the main key player here is the e-cigarettes. And similar patterns were seen in US as well back in 2013 and 14 when e-cigarettes hit the market of US. It was also seen that their revenue went up. Now, what are the causative factors that e-cigarettes suddenly became in fashion for adolescents? And the primary reason was the social media, because as far as Codepa is concerned, we have targeted movie industry as well, that they have to show the warning, and even the tobacco vendors are also under the scanners. Even OTT platform, when they initially came out, although they escaped the code pact because they came up with this phenomenon that we are under the American law, so Indian law is not applicable to us. But fortunately, code pact within 2 to 3 years brought them under the Indian law, and they were avoiding all the rules. But somehow this social media is still not under the scanner of code pact. And there are reports as well that even the social media influencers were paid by the tobacco industry just to make a vlog or just say that vaping has helped them to cut the addiction from cigarettes. And this is just another way of making them addict from one product to other product. And in some cases they also say that cigarette vaping helped them to have weight loss as well. So these are the weak link in our legislation, which tobacco industry is exploiting to a great extent, and even school-going children are being paid for this. And I remember my nephew, who's in 8th standard. A year back, he asked me that, "Hey, Chachu, आपको पता है vape क्या होता है?" And I was so shocked to know this, that he is having this curiosity that what is this thing called as vape, because internet access is everywhere, and they are having they are having access to all these products. So coming on to the theme which most of speakers have discussed about, so bright products and dark intentions. So few days back, I was just surfing online, and I saw that vape products are available on websites, and I can just order something and it will just come direct to my home. And I was shocked to know, because prior to this, I was not knowing that it is easily available online as well. And even if you look at websites like Amazon, they are selling herbal cigarettes in the name that they have, clove or cinnamon, and even uh, as a herbal supplement. So this is just a stepping stone towards addiction. And even all these vape are made in different flavors, so they can attract the young population. In these days, various sports persons are seen in the ads of pan masala brands as well. So generally, the tobacco industry evades tax that pan masala are not having nicotine. So the higher tax bracket is not applicable to these brands. But somehow it's totally a lie, because some fraction of nicotine is present in the pan masala brands as well. And as sportsmen are giving ads of that. So it's quite likely that young population will get will be targeted with this as well. And they may say that if a sports person is giving this ad, then they will indulge in this as well. So if you look at this graph, it gives a quite promising situation that Sweden has went totally like smoke free, because from approximately 11% in 2013, the prevalence has gone down to around 3.5%, and it has achieved the target of less than 5% of like smoke free. Now the problem is this is that is a very false picture painted on the internet. If you will look for any credible websites per se, WHO, CDC, they are not giving this example, but there are other websites which are funded by tobacco industry. They are saying that the Sweden was able to achieve it because they switched to snus and vaping. So snus is a kind of you can say oral form of tobacco, just a kind of gutka which we have in India. So they are advertising snus as it is a pasteurized form of tobacco, because they are heating it so that the nitrosamines are not there, and it is healthy option to leave the cigarettes. So they are just switching from one addiction to other addiction, and internet is flooded by this. And because we live in an era where we are overloaded by information, but we lack the knowledge. So such things are very easy that even youngsters will see such things, and they may say, okay, that if cigarette is a bad thing, that then I can switch to other options which are easy to do. And we should try our best that India should not be on the footsteps of Sweden. So WHO has given a roadmap for tobacco endgame, that is Empower. If we look at the Indian scenario, we are still lacking on raising taxes for like on tobacco products, and data has like proven that if we increase the tax by 10%, the tobacco selling which will go down to approximately 3 to 4%. And enforcing ban on tobacco advertising and promotion also is going on, but these pan masala brands have somehow found a way through this. And even the social media, which is not under the scanner right now, is the prime target of tobacco companies. Now we have two legislation against tobacco in our country, so CODPA Act and PEC Act. As far as Cigarette and Other Tobacco Product Act is concerned, it has done an incredible job throughout the years. From the data warning, which is around 85%, it's almost like quite high as per the other countries are concerned. And even they brought the OTT platform under their belt. That was a commendable job. But there are still some lacking through which the CODPA is not being able to control the tobacco menace as it should be. And one of the things that is that minors are still being sold the like cigarette. Loose cigarettes are still available at the tobacco vendors. And even if you look the PEC Act, although the act came back in 19, but its practical application is almost negligible, because even online websites are selling it openly, and the situation is pretty bad, and we need to speed up as far as PEC Act is concerned, because tobacco companies are exploiting vaping channels. And if we see what we can do in future, so social media has to come under legislation, like people who are flaunting that they are smoking and it is good for health, and the new option like vaping is also being used by social media influencers. So we need to have some legislation for that, and heavy penalties for selling e-cigarettes. Although the PEC Act says that import, selling, or is totally illegal in India, but still it is being done. So we need to bring it into action. Otherwise, it will be too late, because our school-going population is getting affected. And even a few months back, I saw article in the news that even in Ludhiana, the 8th to 10th class students, there was vaping products found in their bags. So it's already been going on. So we can't wait for another few years for for not acting on it. And e-cigarettes should should be displaying health warning covering at least 35% of the display area. As far as the current scenario is concerned, the e-cigarettes come in very fancy things. They even have names like from inspired from the Marvel and DC comics, like so that they can like you can say they can be more appealing to the young population. So all these things should be curbed, and just like Kotpa, we have like very decent 85% of the display area that should be covered by the warning. All the e-cigarettes should come under this umbrella. And lot of misnomer about e-cigarettes is that it is a safer option than the regular cigarettes. And this is a very important point that adolescents or even young children think that it is a safer option, so we can indulge into it. So we need to target them that and make them aware about the harmful effects of e-cigarettes. Increased tax, as we have already like covered this, and banning pan masala advertisements, like because the tobacco industry is just exploiting it because there is nicotine component in it, and whoever is consuming it will get addict, and down the line they will form a habit of consuming higher form of nicotine products in form of cannabis cigarettes or tobacco. And illegal tobacco trade is very common because 1/4 of cigarettes which are selling in India are through illegal tobacco trade. And what the problem in this is that through illegal tobacco trade, they evade the tax as well. So the product is getting to the consumer in a cheaper rate, and tobacco industry is not paying the price like for that. So this thing should be checked as well. So just related to the theme, so like we have new products, same lies, and industry keeps reinventing itself to make more money. It's the same story, but they have just changed the book. So we need to be proactive and we need to preempt that what the industry is going to do, because if we will just act the way we are going to, then they will come up with something new, and will be acting late, and our population will be getting addicted to it. So we need to be one step ahead of the tobacco industry. So that was all for today, and these were my references. Thank you, everyone.
Good afternoon, everyone. Thank you to organizers and principal sir, Tanveen ma'am, for calling me or inviting me as a chairperson. I would also like to congratulate Dr. Pranjal for an eye-opening session. It was a great one. Adequate data, especially from the Great Indian Tobacco Company, was given by you, and it just clicked to me that yes, during COVID eras, people were not smoking that much, and it has really increased over time. And then you gave good example of Sweden. We should not go by the Sweden way. And as you all know, as stressed by Dr. Pranjal, e-cigarettes, the greatest issue now, which has to be dealt, especially amongst the youngsters. Another issue, enforcement of FOTPA. We all know it is very wide in scope, it is comprehensive in nature, but the enforcement is poor till date. And we too are making many loopholes in the act. Like we all have seen public smoking zones in airports. We have seen advertisements on TV, in cinema halls. So there are loopholes still which has to be taken care of. That's all from my side. Congratulations to the speaker and thank you to the organizers. Thank you.
Thank you.
I would like to thank the organizers for inviting me as a chairperson. And coming to the presentation itself, Dr. Pranjal, your presentation was very encompassing. All aspects were covered about FOTPA. And I would like to share our own experience in our medical college. I am from AIMS Mohali. So in our college, we have a team. It is a team which consists of community medicine, psychiatry, as well as dentistry. And this team, every once in a few days, they go around the campus, outside the campus, all areas which are there for 100 yards. And we try to find out all the places which are selling tobacco products, including e-cigarettes. We have found them also. Then we have taken the process of writing to the DC and getting those small shops removed. Small tea shops, small things selling paranthas, they'll be having tobacco products behind the back, they'll be selling them. But we have made quite a lot of effort in our institution. We do it periodically to catch these people, write against them, and have them removed from the premises. So this is our own experience. Thank you so much.
That's a very good initiative, ma'am. Yeah.
That's all from my side.
Thank you to our speakers and our chairpersons. Thank you for joining us. Through these sessions, we have journeyed through the multifaceted impacts of tobacco, from oral and mental health consequences to carcinogenic effects and legal frameworks like COFA. We thank all our distinguished speakers for generously sharing the knowledge and experiences, and we extend heartfelt gratitude to our chairpersons for skillfully moderating the sessions. Now, it is said that the strength of any institution lies in the vision of its leadership. Today, we are deeply honored to be joined by the esteemed dignitaries of Adesh University, whose continued support and guidance serve as the cornerstone of all our academic and public health endeavors. Now, I request Dr. Tanveer ma'am to kindly come forward and welcome our advisors and esteemed dignitaries.
Good afternoon, everyone. Once again, on behalf of the organizing committee, I, Dr. Tanveer Kaur Sidhu, Professor and Head of Community Medicine at Adesh Institute of Medical Sciences and Research, extend a heartfelt welcome to each one of you who has been participating in this CME since morning. We are here to convene the World No Tobacco Day celebrations for the year 2025. As we embark to the next segment of today's events, it's my privilege to extend a warm welcome to our distinguished dignitaries. Firstly, we extend a warm thanks to our esteemed patrons of Adesh University, Dr. H.S. Gill, Honorable Chancellor Sir, and Dr. Gurpreet Singh Gill, Medical Superintendent Administration, and also who was the pre-AIMSR observer for today's event. We are privileged to welcome our respected Vice Chancellor Sir, Colonel Jagdev Singh, along with Professor R.G. Saini, Registrar and Dean PG Studies and Research, Dr. Harkiran Kaur Ma'am, Dean Faculty of Medical Sciences, and Dr. Pramod Kumar Goyal, Principal at Adesh Institute of Medical Sciences and Research. Your presence today is an honor and adds immense value to this occasion. We had a very engaging academic environment in today's continuing medical education sessions under the auspices of IAPSM, that is Indian Association of Preventive and Social Medicine, and Resource Center for Tobacco Control at PGIMR, Chandigarh. We were extremely delighted to have with us Dr. Ashok Bhardwaj, the National President of IAPSM, and Dr. Manish Kumar Singh, Secretary General of National IAPSM, who were with us since morning through the sessions. We also had the unwavering support of Punjab chapter of IAPSM with presence of Dr. Jasleen Kaur, President, and Dr. Preeti Pada, the General Secretary. As proud members of the Consortium of Medical Colleges for Tobacco-Free India, led by Resource Center for Tobacco Control at PGIMER Chandigarh, we were honored to have the support of Dr. Sonu Goyal, Director of ERCTC and Professor at PGI Chandigarh. Our special thanks goes to our esteemed guest speakers who have been enlightening us since morning, Dr. Rakesh Kakkar, Professor and Head of Community and Family Medicine at AIMSR Bathinda, Dr. Vikrant Ranjan Mohanty, Professor and Head of Public Health Dentistry at Maulana Azad Institute of Dental Sciences, Delhi, Dr. Bharat Uday, Associate Professor of Psychiatry at AIMSR Bathinda, Dr. Pranjal Sharma, Assistant Professor of Community Medicine at DMCH Ludhiana, and Dr. Jagrati, Assistant Professor of Community Medicine at AIMSR. They have shared with us valuable insights on the current challenges of tobacco use in India and enriched our collective knowledge. We were joined by our session chairpersons, delegates, community medicine HODs, and faculty of medical colleges of Punjab, and undergraduate and postgraduate students through the hybrid event that is physically here in the MEU and also through the Zoom platform. We also had live streamed the guest sessions through the YouTube, and even currently we are live streaming the events. A special welcome to the principals of constituent colleges, especially Dr. Sridhar sir from Nursing College, faculty and students from all colleges of Adesh University who have actively engaged in various events over the past 1 month. Today's CME represents the culmination of year-long efforts and recent intensive activities aimed at raising the awareness about the grave use of tobacco. Our theme, From Policy to Prevention, Public Health Frontlines and Tobacco Control, underscores our commitment at Adesh University to address this significant public health problem. Today, we stand united in safeguarding the future of our younger generations by exploring the theme of this year's World No Tobacco Day, that is unmasking the appeal, exposing industry tactics on tobacco and nicotine products. Once again, a warm welcome to each and every one of you. Let us immerse ourselves in the collective spirit that defines today's proceedings. Now, further to brief you about the events and the activities conducted by Adesh University under the Department of Community Medicine at AIMSR, I invite our nodal officer for RCTC, Dr. Japneet, to share with us the report of the year-long activities.
Thank you, ma'am. Good afternoon, everyone. Let's look back into the activities that were covered under World No Tobacco Day 2025 in the month of May. First of all, we organized a community-based health talk in Mehraj village, which is one of our adopted villages. Information was given about the harmful effects of tobacco, covering the ill impact of secondhand smoking and how it's harmful for the family and the measures to help overcome this evil. For this activity, supervisor was Dr. Shyam Mehra with co-supervisors Dr. Basirat and Dr. Jagrati. Health talk was delivered by Dr. Maninder, who is PG first year in the department, and Dr. Kanika, PG second year. The supporting members were MBBS students of batch 2024 and our social workers, Mr. Jasveer Singh and Mrs. Swaranjeet Kaur and Mrs. Karanjeet Kaur. The health talk was delivered at a bus stand at Mehraj village. In addition to this, one-on-one health talk was also delivered by MBBS students in their respective adopted families. Next, we organized a school-based health talk about the awareness of the harmful effects of tobacco on teen health, ill impact of secondhand smoke, and how it's harmful for the family, in addition to the role of children in carrying forward this important health messages to their family and friends. The supervisors for the activity were Dr. Jagrati and myself. Health talk was delivered by Dr. Kanika, who is a PG second year, and Dr. Maninder. Target audience covered was students of class 6 to 12 of Government Senior Secondary School in Halayana. The supporting members were MBBS students and our social workers, Mr. Jasveer Singh, and ANM, Mrs. Gurjeet Kaur and Jagjeet Kaur. This was followed by Nukkad Natak played by students of Paramedical College, Adesh University. We thank you, students. Under the supervision of the faculty, Mr. Gagandeep Kamboj. Our department, in addition, also organized a poster competition for the school students to spread the message of say no to tobacco. Then winners from each class from 6 to 12 were awarded by the Department of Community Medicine and the school principal. These were the students who were awarded prizes, and here we are also having the students of Paramedical College perform the Nukkad Natak at Government Senior Secondary School, Halayana. The Nukkad Natak competition then was conducted at university level on the theme Risks and Dangers of Tobacco Use and Encouraging People to Quit Tobacco Use. Total 4 teams participated from various colleges like Paramedical College, Physiotherapy College, Dental College, and Nursing College. Then, once again, we conducted a Nukkad Natak in the community at Nathana. Final judgment of the 4 Nukkad Nataks, it was done in the department itself of Community Medicine by Dr. Monica Gupta, Dr. Shweta Singla, and Dr. Satnam Singh. Alongside this, we also organized a real competition at the university level, where we had entries from various colleges like AIMSR, Nursing College, College of Physiotherapy, and Paramedical College. On the theme, Unmasking the Trend, the Hidden Dangers of Modern Tobacco Use Among Youth. This competition had more than 20 entries, and final judgment was done in the department itself by Dr. Rajvinder Kaur, Dr. Gesu Singla, and Dr. Amandeep Kaur. Last but not the least, we also organized a poster competition for MBBS students today itself, and the final judgment was done by Dr. Kapil and Dr. Ruchika. And today, in observance of World No Tobacco Day 2025, we have organized the CME to empower medical professionals to be advocates for tobacco control policies. This CME was organized by Department of Community Medicine under the aegis of IAPSM and RCTs. I would like to thank our HOD ma'am, Dr. Tanveer Kaur, for her constant support, and my fellow faculty members, Dr. Sham, Dr. Varun sir, Dr. Harsh, Dr. Gurkirat, Dr. Jagrati, and our PG residents, Dr. Kanika and Dr. Maninder, plus our social workers for constant motivation and always being by my side, be it whatever activity I have organized. Thank you all for making this event a success. Thank you. Now over to Dr. Jagrati and Dr. Kanika for the next part of the event.
Good afternoon, everyone. Before we move ahead, let's take a moment to celebrate some true champions of creativity and awareness. We are thrilled to announce the results of a Nukkad Natak competition, which was judged by our respected faculty members. So, the fourth position is begged by the Dental College of Adesh. Please give us a round of applause. Third position is begged by Paramedical College of Adesh. Second position is begged by Physiotherapy College of Adesh. And the winner for the Nukkad Natak competition is the talented students of the Nursing College. And now we request all the participants to please come forward and perform the Nukkad Natak. Nursing College in
Good afternoon, everyone. My name is Neha Sharma and we are from College of Nursing.
My name is Bulldozer. My name is Dr. Hussain.
My name is Dr. My name is Sakina. My name is Jessica. My name is Kushi. Myself is Pitpal. My name is Rashmi Kaur. My name is Jasmine. My name is Prabuddha. My name is Sukhpal.
सुनो सुनो भाई सुनो 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 ये गली में तो शोर है ये गली में तो शोर है
विद्यार्थी आज ਤੁਹਾਡੇ ਸਾਹਮਣੇ ਇੱਕ ਨੁੱਕੜ ਨਾਟਕ ਪੇਸ਼ ਕਰਨ ਜਾ ਰਹੇ ਹਾਂ। ਸਾਡਾ ਅਗਲਾ ਨੁੱਕੜ ਨਾਟਕ ਤੰਬਾਕੂ ਤੇ ਹੈ, ਜੋ ਕਿ ਘਰ ਘਰ ਦੀ ਕਹਾਣੀ ਬਣ ਚੁੱਕੀ ਹੈ। ਇਹ ਨਾਟਕ ਇੱਕ ਆਮ ਘਰ ਦੀ ਕਹਾਣੀ ਤੋਂ ਸ਼ੁਰੂ ਹੁੰਦਾ ਹੈ।
ਹਾਂਜੀ ਆ ਗਏ ਤੁਸੀਂ?
ਆ ਗਿਆ ਭਗਵਾਨ ਨੇ। ਮੈਂ ਤਾਂ ਕਹਿੰਦਾ ਹੀ ਆਪਣੀ ਫਸਲ ਨੇ ਬੜਾ ਘਾਟਾ ਪਾਇਆ ਪੜਦਾ ਹੈ। ਤੇ ਹੋਰ ਇਹ ਤਾਂ ਬਸ ਬੜੀ ਮਾੜੀ ਹੋਈ ਆ ਆਪਣੀ।
ਨੇ ਕਰਕੇ ਰੱਬ ਨੇ ਮਾਰ ਆ।
ਤੇ ਹੋਰ ਕੀ ਕਰੀਏ?
ਮੰਮੀ ਡੈਡੀ ਸਾਡਾ ਨਾ 12ਵੀਂ ਦਾ ਰਿਜ਼ਲਟ ਆ ਗਿਆ।
ਮੈਂ ਪੁੱਛ ਕਿੰਨੇ ਨੰਬਰ ਆ ਗਏ ਤੁਹਾਡੇ? ਮੇਰੇ 92%।
ਮੰਮੀ 90% ਹੀ।
ਉਹ ਤਾਂ ਬਲਾਈ ਵਧੀਆ ਨੰਬਰ ਆ ਗਏ ਫਿਰ ਤੁਹਾਡੇ ਤਾਂ। ਹੁਣ ਅਸੀਂ ਨਾ ਵੱਡੇ ਕਾਲਜ ਪੜ੍ਹਨ ਜਾਣਾ ਸ਼ਹਿਰ।
ਹਾਂਜੀ ਬਾਪੂ ਹੁਣ ਅਸੀਂ ਨਾ ਸ਼ਹਿਰ ਪੜ੍ਹਨ ਲੱਗਣਾ ਜੀ ਕਾਲਜ ਚ ਜੀ। ਉਹ ਤਾਂ ਕਿੱਥੋਂ ਪੜ੍ਹਾ ਦਾਂਗੇ ਤੁਹਾਨੂੰ ਵੱਡੇ ਕਾਲਜ ਚ। ਐਤਕੀ ਤਾਂ ਆਪਣੀ ਫਸਲ ਨੇ ਬੜਾ ਘਾਟਾ ਪਾਇਆ ਆਪਾਂ ਨੂੰ।
ਪਰ ਬਾਪੂ ਅਸੀਂ ਉੱਥੇ ਪੜ੍ਹ ਕੇ ਵੱਡੇ ਅਫਸਰ ਬਣਾਂਗੇ।
ਬਾਪੂ ਤੇਰਾ ਅਸੀਂ ਨਾਮ ਰੋਸ਼ਨ ਕਰਾਂਗੇ ਉੱਥੇ ਪੜ੍ਹ ਕੇ। ਚਲੋ ਕੋਈ ਨਾ ਪੁੱਤ ਅਸੀਂ ਕੋਈ ਹੱਲ ਕਰ ਦਿਓ, ਤੁਸੀਂ ਕਿਹੜਾ ਜਾ ਕੇ ਬੈਠੋ।
ਹਾਂਜੀ ਮੇਰਾ ਪੁੱਤ ਜਾਓ।
ਕੀ ਕਰਕੇ ਭਾਦਵਾਂਗੇ ਹੁਣ ਫਿਰ ਆਪਾਂ?
ਜੀ ਆਪਣੇ ਦਾ ਜਵਾਕ ਵੀ ਸੁਪਨਾ ਬਲਾਈ ਸਿਆਣੇ ਆ, ਕਿੰਨਾ ਪੜ੍ਹਦੇ ਆ, ਕਿੰਨੇ ਸਿਆਣੇ ਆ। ਤੁਸੀਂ ਕੋਈ ਹੀਲਾ ਕਰੋ ਨਾ ਪੈਸਿਆਂ ਦਾ।
ਚਲੋ ਫਿਰ ਆਏ ਕਰਦੇ ਆ, ਆਪਣੀ ਜ਼ਮੀਨ ਤੇ ਕਰਜ਼ਾ ਚੱਕ ਲੈਂਦੇ ਤੇ ਇਹਨਾਂ ਨੂੰ ਪੜ੍ਹਾ ਦਿੰਦੇ ਆ ਜਵਾਕਾਂ ਨੂੰ।
ਹਾਂਜੀ ਜਿਵੇਂ ਤੁਹਾਨੂੰ ਠੀਕ ਲੱਗਦਾ ਤੁਸੀਂ ਕਰੋ।
ਚਲੋ ਮੈਂ ਆਪ ਤੇ ਕਿਹਨਾਂ ਕਰਕੇ ਆਉਂਦਾ ਗੱਲ।
ਠੀਕ ਹੈ। आगे ਤੁਸੀਂ
ਆਗੇ ਭਗਵਾਨੇ ਮੈਂ ਤਾਂ ਇਹ ਕਹਿੰਦਾ ਸੀ ਜਵਾਕਾਂ ਦਾ ਦਾਖਲਾ ਕਰਾਇਆ ਮੈਂ ਸ਼ਹਿਰ ਕਾਲਜ ਚ
ਜੀ ਆਰਟੀ ਨੇ ਦੇਤੇ ਸੀ ਪੈਸੇ
ਹਾਂ ਆਰਟੀ ਨੇ ਪੈਸੇ ਦੇ ਦਿੱਤੇ ਸੀ
ਲੱਗਦੇ ਤਾਂ ਬਲਾਈ ਵਧੀਆ ਗੱਲ ਹੈ ਜਵਾਕੋ ਹਾਂਜੀ
ਮੰਮੀ ਹਾਂਜੀ ਡੈਡੀ ਪੁੱਤ ਮੈਂ ਤਾਂ ਤੁਹਾਨੂੰ ਐਂ ਕਹਿੰਦਾ ਸੀ ਤੁਹਾਡਾ ਦਾਖਲਾ ਕਰਾਇਆ ਮੈਂ ਸ਼ਹਿਰ ਕਾਲਜ ਚ
ਹੁਣ ਅਸੀਂ ਉੱਥੇ ਹੀ ਰਹਾਂਗੇ
ਹਾਂ ਪੁੱਤ ਹੁਣ ਤੁਸੀਂ ਉੱਥੇ ਹੀ ਰਹੋਗੇ
ਉਦੋਂ ਤੁਸੀਂ ਕੱਲ ਨੂੰ ਆਏਗਾ ਤੇ ਰੋਟੀ ਖਾ ਕੇ ਖਾਣ ਬਾਤ ਦੇਣੀ ਹੈ
ਠੀਕ ਹੈ
गुड मॉर्निंग आज कॉलेज का पहला दिन है कोई गल नहीं लेट हो गया अबे तो लेट नहीं होना बैठ जाओ आज कॉलेज का पहला दिन है ਆਪਾਂ ਕੁਝ ਵੀ ਗੱਲਾਂ ਕਰਦੇ ਆਂਗੇ ਤੁਸੀਂ ਸਾਰੇ ਇੱਥੇ ਚੰਗਾ ਪੜ੍ਹ ਕੇ ਆਏ ਹੋ ਚੰਗੀ ਪਰਸੈਂਟੇਜ ਲੈ ਕੇ ਆਏ ਹੋਗੇ ਇੱਥੇ ਵੀ ਸਿਰਫ ਆਪਣਾ ਪੜ੍ਹਾਈ 'ਚ ਧਿਆਨ ਦੇਣਾ ਹੈ ਕਿਸੇ ਦੇ ਮਗਰ ਨਹੀਂ ਲੱਗਣਾ ਤੇ ਮਾੜੀ ਸੰਗਤ ਤੋਂ ਦੂਰ ਰਹਿਣਾ ਹੈ ਅੱਜ ਜਾ ਕੇ ਤੁਸੀਂ ਆਪਣਾ ਕੈਂਪਸ ਘੁੰਮ ਲਓ ਕੱਲ ਤੋਂ ਆਪਾਂ ਪੜ੍ਹਾਈ ਸ਼ੁਰੂ ਕਰਦੇ ਹਾਂ ਓਕੇ ਮੈਮ
ਗੱਲ ਪਈ ਆ ਸਮਾਂ ਉਹ ਦਿਖਾਈ ਨਹੀਂ ਦਿੰਦਾ ਤੁਹਾਡੇ ਸੀਨੀਅਰ ਤੁਰੇ ਆਉਂਦੇ ਆ ਬੋਡੀ ਤੇ ਗਲਤੀ ਹੋਈ ਤੇ ਤੁਹਾਨੂੰ ਪਤਾ ਨਹੀਂ ਲੱਗਿਆ ਪਲੀਜ਼
ਨਵੀਂ ਇਹ ਲੱਗਦਾ ਮੈਨੂੰ ਕਾਲਜ 'ਚ ਪਹਿਲਾਂ
ਚਲ ਕੋਈ ਗੱਲ ਨਹੀਂ ਅੱਗੇ ਤੋਂ ਧਿਆਨ ਰੱਖਣ ਵਾਲੇ ਅੱਖਾਂ ਖੋਲ ਕੇ ਤੁਰੀਦਾ ਹੁੰਦਾਗਾ ਕੋਈ ਗੱਲ ਬਈ ਕੋਈ ਨਾ ਕੋਈ ਗੱਲ ਚਲੋ ਠੀਕ ਆ ਹੁਣ ਜਾਓ ਕੋਈ ਗੱਲ ਨਹੀਂ ਠੀਕ
ਆਪਾਂ ਨੂੰ ਪੈਸੇ ਦਾ ਹਿੱਲਾ ਕਰਨਾ ਪੈਣਾ ਨਸ਼ੇ ਛੱਡ
ਮੈਨੂੰ ਲੱਗਦਾ ਜਿਹੜੇ ਆਪਣੇ ਨਵੇਂ ਜੂਨੀਅਰ ਆਏ ਨੇ ਇਹਨਾਂ ਨੂੰ ਆਪਣੇ ਯਾਦ ਦੇ ਵਿੱਚ ਸੌਣਾ ਪਊਗਾ ਫੇਰ ਹੀ ਆਪਣੇ ਕੋਲ ਆਇਆ ਕਰਦੇ ਚੱਲਦੇ ਆ ਦੱਸ ਨਹੀਂ ਸੀਨੀਅਰ ਨਹੀਂ ਬੈਠੇ ਹੋਰ ਤਾਂ ਨਹੀਂ ਕਹਿੰਦੇ ਵਧੀਆ ਭਾਈ ਤੁਸੀਂ ਦੱਸੋ
ਭਾਈ ਤੁਸੀਂ ਆ ਕੇ ਕਿਹਾ ਵਾਲੀ ਵਧੀਆ ਚੀਜ਼
ਨਹੀਂ ਭਾਈ ਇਹਦਾ ਗੱਲ ਕੀ ਹੈ ਭਾਈ ਇਹ ਨਾਲ ਤਾਂ ਭਾਈ ਪੜ੍ਹਾਈ ਦੇ ਵਿੱਚ ਮਨ ਲੱਗਦਾ ਨਹੀਂ ਭਾਈ ਇਹ ਤਾਂ ਵੀ ਬਹੁਤ ਗਲਤ ਚੀਜ਼ ਹੈ ਨਾ ਬੰਦਾ ਮਾਰ ਹੋ ਜਾਂਦਾ ਨਾ ਮੈਨੂੰ ਸੇ ਕਰੀ ਕਰਕੇ ਤਾਂ ਦੇਖੋ ਯਾਰ ਨਹੀਂ ਭਾਈ ਕਰਕੇ ਦੇਖੋ ਨਾ ਨਾ ਕਰਕੇ ਤਾਂ ਦੇਖੋ ਯਾਰ ਨਾ ਨਹੀਂ ਨਾ ਚਲ ਕੋਈ ਗੱਲ ਨਹੀਂ ਭਾਈ ਜਦੋਂ ਅੱਗੇ ਲੋੜ ਹੋਈ ਜਦੋਂ ਮਰਜ਼ੀ ਆ ਜਾਓ ਆਪਾਂ ਇੱਥੇ ਹੁੰਨੇ ਆ ਕੋਈ ਨਾ ਬਈ
ਮੇਰਾ ਆਦਤ ਹੋ ਗਈ ਆਪਣੇ ਕੋਲ ਆਇਆ ਕਰ ਲੋਗੇ
ਹੁੰਦਾ ਆਪਣੇ ਯਾਦ ਦੇ ਵਿੱਚ ਫਸ ਗਏ ਹੁੰਦਾ ਆਪਣੇ ਕੋਲ ਡੇਲੀ ਪਰ ਉਹ ਹੈਗਾ ਜਿਹੜੇ ਆਪਣੇ ਕੋਲੇ
और भी हो गया आज
ਚਲੋ ਦੇਖੋ ਕਰਵਾਉਂਦੇ ਆ ਓਏ ਆ ਬੈਠਾ ਹੋਰ ਬਈ ਚਲੋ ਕਿਵੇਂ ਬਈ ਠੀਕ ਨਾ ਬਈ
भाई साथ तो तोड़ लगी पई है नशे दी
नहीं भाई उन्हें मिलता
ਭਾਈ ਬੰਦਾ ਭਾਈ ਥੋੜਾ ਜਿਹਾ ਦੇ ਦੇ ਯਾਰ ਤੂੰ ਵੀ ਯਾਰ ਜ਼ਰੂਰੀ ਲੋੜ ਹੈ ਤੇਰੇ ਕੋਲ ਹੀ ਹੈ ਭਾਈ ਨਾ ਭਾਈ ਹੁਣ ਤਾਂ ਦੇ ਪੈਸੇ ਲੱਗਣਗੇ ਹੁਣੇ ਤਾਂ ਉਹਨੂੰ ਫ੍ਰੀ ਹੋ ਮਿਲਦਾ ਭਾਈ ਤੁਹਾਡੇ ਕੋਲ ਪੈਸੇ ਨਹੀਂ ਆਏ ਤਾਂ ਥੋੜਾ ਜਿਹਾ ਦੇ ਦੋ ਸਾਨੂੰ ਨਹੀਂ ਭਾਈ ਪੈਸੇ ਲੱਗਣਗੇ ਹੁਣ ਤਾਂ ਦੇ ਪੈਸੇ ਭਾਈ ਸਾਡੇ ਕੋਲ ਤਾਂ ਨਹੀਂ ਪੈਸੇ ਆ ਇਹਨਾਂ ਦਾ ਦੇ ਦੋ ਥੋੜਾ ਜਿਹਾ ਚੱਲ ਭਾਈ ਜਿੰਨੇ ਹੈਗੇ ਤੁਸੀਂ ਉਹਨੇ ਦੋ ਫਿਰ
मैंने पैसे थोड़े लोग आज को नहीं मांगे
ਆਲੂ ਭਾਈ ਤੁਹਾਡੇ ਪੈਸੇ ਥੋੜੇ ਤੇ ਤੁਹਾਨੂੰ ਥੋੜਾ ਸਮਾਨ ਹੀ ਮਿਲੂਗਾ ਅੱਗੇ ਤੋਂ ਪੈਸੇ ਪੂਰੇ ਲੈ ਕੇ ਆਉਣੇ ਆ ਠੀਕ ਆ ਘੱਟ ਪੈਸੇ ਤੇ ਤੁਹਾਨੂੰ ਸਮਾਨ ਨਹੀਂ ਮਿਲਣਾ
चाहे आप दे अपने घर एक कर दो बिना पैसे तो उन्हें मिल
ਹੈਲੋ ਮੰਮੀ ਮੈਨੂੰ ਪੈਸੇ ਚਾਹੀਦੇ ਸੀ
ਉਹ ਤੇ ਕੱਲ ਤੋਂ ਤੁਹਾਡੀ ਫੀਸ ਭਰੀ ਸੀ
ਨਹੀਂ ਨਹੀਂ ਮੰਮੀ ਮੈਂ ਤਾਂ ਹੋਰ ਪੈਸੇ ਭੇਜ
ਹਾਏ ਭਾਈ ਹੁਣ ਨਹੀਂ ਕੱਟਦਾ ਚੱਲ ਮੈਂ ਚੱਲੀ ਕੇ ਘਰ ਜਾ ਕੇ ਆਉਂਦੀ ਆ ਉਹਨਾਂ ਦੇ ਬੱਚੇ ਵੀ ਉੱਥੇ ਹੀ ਪੜ੍ਹਦੇ ਨੇ ਮੈਂ ਭਾਈ
ਘਰਈਆਂ ਭਾਈ ਲੱਗਿਆ ਹੋ ਭਗਵਾਨ ਨੇ ਆ ਭੈਣ ਸੀ ਤੋਂ ਆਈ ਆ ਬਾਹਰ
ਕਹਿੰਦੇ ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਕੀ ਹਾਲ ਹੈ ਅਸ਼ਵਨੀ ਕੀ ਆ ਭੈਣੇ ਕਿਵੇਂ ਭੈਣੇ ਕੀ ਗੱਲ ਹੋ ਗਈ ਮੇਰਾ ਮੁੰਡਾ ਮੇਰੇ ਤੋਂ ਪੈਸੇ ਮੰਗ ਰਿਹਾ ਸੀਗਾ ਸਾਡਿਆਂ ਦਾ ਵੀ ਸਵੇਰੇ ਫੋਨ ਆਇਆ ਸੀ ਪੈਸੇ ਮੰਗਦੇ ਸੀ
ਚਲ ਕੋਈ ਨਾ ਭਾਈ ਜਿੰਨੇ ਕੁ ਹੋਏ ਸਾਡੇ ਕੋਲੇ ਉਹਨੇ ਕੁ ਦੇ ਦਾਂਗੇ ਤੁਹਾਨੂੰ ਵੀ ਅਸੀਂ
ਚਲ ਜੀ ਆਪਾਂ ਇਹ ਕਰਾਂਗੇ ਨਾਲੇ ਕੱਲ ਨੂੰ ਮਿਲ ਆਵਾਂਗੇ ਪੈਸੇ ਫੜਾਵਾਂਗੇ ਨਾਲੇ ਉਹਨਾਂ ਖਾਤਰ ਦੇਸੀ ਘਿਓ ਦਾ ਪੀਪਾ ਲੈ ਕੇ ਜਾਣਾ ਵਿਚਾਰੇ ਸ਼ਹਿਰ ਪੜਦੇ ਆ ਬਲਾਈ ਕਮਜ਼ੋਰ ਹੋਏ ਪਏ ਆ
ਹਾਂ ਚਲ ਭਾਈ ਤੜਕੇ 9 ਵਾਲੀ ਬੱਸ ਨੂੰ ਤਿਆਰ ਰਹੋ
भैया आवड़े मानता बाड़ा ही बढ़िया इस मार के बढ़िया पैसे दे
ਭਾਈ ਪੈਸੇ ਦਾ ਮੰਗਾਏਗਾ ਕਰੋ ਪੈਸੇ ਦੀ ਬਸ ਭਾਈ ਜਿੰਨਾ ਟਾਈਮ ਤੁਹਾਡਾ ਬਾਈ ਬੇਟਾ ਤੁਹਾਨੂੰ ਫਿਰ ਕਰਨ ਦੀ ਲੋੜ ਨਹੀਂ ਤੁਸੀਂ ਪੈਸੇ ਲਿਆਈ ਚੱਲੋ ਤੇ ਤੁਹਾਨੂੰ ਸਮਾਨ ਵੀ ਨਹੀਂ ਚੱਲੂਗਾ ਹਾਂ ਵਧੀਆ ਅੱਗੇ ਨਾਲ ਵੀ ਵਧੀਆ ਸੀਗਾ
नहीं बढ़िया चाहिए
ਕੋਈ ਗੱਲ ਨਹੀਂ ਭਾਈ ਪੈਸੇ ਨਹੀਂ ਭਗਵਾਨ ਨੇ ਆ ਜਾਓ ਕੋਈ ਗੱਲ ਨਹੀਂ ਤੁਸੀਂ ਪੈਸੇ ਲੈ ਚਲੋ ਬਸ ਤੁਹਾਨੂੰ ਸਮਾਨ ਮਿਲ ਜੂਗਾ ਜਿੰਨਾ ਟਾਈਮ ਤੁਹਾਡਾ ਬਾਈ ਬੈਠਾ ਨਾ ਕਿਸੇ ਚੀਜ਼ ਦੀ ਫਿਕਰ ਕਰਨ ਦੀ ਲੋੜ ਨਹੀਂ
ਰਾਜਾ ਸਾਡੇ ਨਾਲ ਜਵਾਕ ਪੜ੍ਹਦੇ ਆ ਕਾਲਜ ਵਿੱਚ ਅਸੀਂ ਉਹਨਾਂ ਨੂੰ ਮਿਲਣ ਆਏ ਸੀ ਨਾਲੇ ਕੁਝ ਸਮਾਨ ਫੜਾਉਣਾ ਸੀ ਕੀ ਨਾਮ ਸੀ ਉਹਨਾਂ ਦੇ ਵੀ ਉਹਨਾਂ ਦਾ ਰਾਜਵੀਰ ਤੇ ਜਸਪ੍ਰੀਤ ਠੀਕ ਹੈ ਜੀ ਉਹ ਤੁਹਾਡੇ ਬੱਚੇ ਨੇ ਤੁਸੀਂ ਉਹਨਾਂ ਨੂੰ ਸਮਝਾਓ ਉਹ ਨਸ਼ੇ ਵਿੱਚ ਪੈ ਰਹੇ ਨੇ ਗਲਤ ਸੰਗਤ ਵਿੱਚ ਸਾਡੇ ਜਵਾਕ ਗਲਤ ਸੰਗਤ ਚ ਹਾਂਜੀ ਆਜੋ ਜੀ ਤੁਹਾਨੂੰ ਉਹਨਾਂ ਤੋਂ ਲੈ ਕੇ ਚੱਲਦੇ
ਅੱਜ ਕਰੀਏ ਹੋਏ ਇੱਥੇ ਪਾਣੀ ਬਾਪੂ
ਕੀ ਕਰਦੇ ਹੋ ਇੱਥੇ
ਨਸ਼ਾ ਕਰਨ ਭੇਜਿਆ ਤੁਹਾਨੂੰ ਇੱਥੇ ਨਹੀਂ ਬਾਪੂ
ਤੁਹਾਡੀਆਂ ਫੀਸਾਂ ਭਰੀਆਂ ਕਿੰਨੇ ਔਖੇ ਹੋ ਗਏ ਤੁਹਾਨੂੰ ਇੱਥੇ ਪੜ੍ਹਨ ਭੇਜਿਆ ਤੁਹਾਨੂੰ ਪਤਾ ਨਹੀਂ ਹੈ ਤੇ ਤੁਸੀਂ ਇੱਥੇ ਆ ਕੁਛ ਕਰਦੇ ਫਿਰਦੇ ਹੋ ਅਸੀਂ ਤਾਂ ਪੜ੍ਹਦੇ ਸੀ ਨਹੀਂ ਕਰਨੀਆਂ ਪੜਾਣਾ ਬਹੁਤ ਹੋਣਾ ਪੜਾਣਾ ਚਲੋ ਕਰੇ
ਚਲੋ ਇਹ ਕਰਾਂ
ਹਾਏ ਮੈਂ ਤਾਂ ਲੁੱਟੀ ਗਈ ਮੈਂ ਤੈਨੂੰ ਇਸ ਕੁਛ ਕਰਨ ਨੂੰ ਭੇਜਿਆ ਸੀ ਉੱਥੇ
ਉਹ ਨਾ ਮਾਤਾ ਮੈਂ ਤਾਂ ਪੜ੍ਹਨ ਨਹੀਂ ਆਇਆ ਇੱਥੇ
ਪਹਿਲਾਂ ਸਿਰਾ ਪਿਓ ਨਸ਼ੇ ਕਰਕੇ ਮੁੱਕ ਗਿਆ ਤੇ ਹੁਣ ਤੂੰ
ਨਹੀਂ ਮਾਤਾ ਮੈਂ ਨਹੀਂ ਕੋਈ ਨਸ਼ਾ ਕਰਦਾ
ਮੈਂ ਤਾਂ ਲੋਕਾਂ ਕੋਲੋਂ ਪੈਸੇ ਮੰਗ ਤੇਰੀਆਂ ਫੀਸਾਂ ਭਰੀਆਂ ਤੈਨੂੰ ਪਾਲਿਆ ਪਲੋਸਿਆ ਵੱਡਾ ਕੀਤਾ ਤੇ ਤੂੰ ਮੈਨੂੰ ਇਹ ਨਤੀਜਾ ਦੇ ਰਿਹਾ
ਨਾ ਮਾਤਾ ਉਠਾਇਆ ਚੱਲੀਏ
ਪੂਰਾ ਤਰਸ ਨਹੀਂ ਆਇਆ
ਮਾਤਾ ਮੈਨੂੰ ਨਸ਼ੇ ਨੂੰ ਪੈਸੇ ਦੇ ਦੇ ਇੱਧਰ ਹੋ ਗਏ ਨਾ ਮਾਤਾ ਮੈਨੂੰ ਆ ਦੇ ਪੈਸੇ ਦੇ ਦੇ
ਚੱਲ ਕਰ ਤੂੰ ਪੰਜਾਬ ਦੇ ਹਾਲਾਤ ਦੇ ਨੌਜਵਾਨ ਖਾਦੇ ਪੰਜਾਬ ਦੇ ਹਾਲਾਤ ਦੇ ਨੌਜਵਾਨ ਖਾਦੇ ਨਸ਼ਿਆਂ ਦਾ ਘੇਰਾ ਹੈ ਤੇਰਾ ਹੈ ਨਸ਼ਿਆਂ ਦਾ ਮੇਰਾ
ਮਾਂ ਮੈਂ ਪੈਸੇ ਨਹੀਂ ਚਾਹੀਦੇ
ਕਿਸ ਕੰਮ ਨੂੰ ਪੈਸੇ ਚਾਹੀਦੇ ਹੋ ਤੈਨੂੰ
ਮਾਂ ਮੇਰਾ ਤਾਂ ਸ਼ਰੀਰ ਟੁੱਟਦਾ ਮਾਂ ਮੈਨੂੰ ਪੈਸੇ ਦੇ ਦੂ ਇਹ
ਚਾਚਾ ਜਾ ਕੇ ਤੁਹਾਡੇ ਕੋਲ ਫੀਸ ਭਰੀਆਂ ਸੀ ਸਭ ਸ਼ਹਿਰ ਫੜਦੇ
ਆਏ ਨਾ ਕਰ ਮਾਂ ਬਾਪ ਮੇਰੇ ਥੋੜੇ ਪੈਸੇ ਦੇ ਦੇ ਮਾਂ
1 ਰੁਪਿਆ ਨਹੀਂ ਸਾਡੇ ਕੋਲ ਨਸ਼ੇ ਖਾਤਰ
ਚੱਲ ਠੀਕ ਆ ਮੈਂ ਤਾਂ ਆਪਦਾ ਹਲਾਪੇ ਕਰ ਕੀ ਗੱਲ ਆ ਬਾਪੂ ਮੈਨੂੰ ਤਾਂ ਪੈਸੇ ਚਾਹੀਦੇ ਬਾਪੂ ਮੇਰਾ ਸ਼ਰੀਰ ਟੁੱਟੀ ਜਾਂਦਾ ਪੈਸੇ ਸਾਡੇ ਕੋਲੇ ਬਾਪੂ ਮੈਨੂੰ ਤਾਂ ਪੈਸੇ ਦੇ ਬਾਪੂ ਮੈਨੂੰ ਨਹੀਂ ਪਤਾ ਬਾਪੂ
ਹਾਏ ਕੀ ਕਰਾਉਣਾ ਸੀ ਅਸੀਂ ਇਹ ਜੀ ਗੰਦੀ ਲਾਤ ਤੋਂ ਇਦੋਂ ਤਾਂ ਅਸੀਂ ਬੇਲਾਦੀ ਚੰਗੇ ਸੀ ਕਾਦੀਆਂ ਪੜਾਈਆਂ ਸ਼ਹਿਰ ਨਸ਼ਿਆਂ ਦੇ ਲੱਗੇ ਅਨਪੜ੍ਹੀ ਚੰਗੇ ਸੀ ਸਾਡੇ ਜਵਾਕ ਤੇ ਨਸ਼ਿਆਂ ਤੋਂ
ਭਾਈ ਰੱਬਾ ਕੀ ਕਰਾਂ ਮੇਰੇ ਤਾਂ ਹੱਥ ਪੱਲੇ ਵੀ ਕੁਛ ਨਹੀਂ ਆਇਆ ਇਹ ਜਵਾਕ ਜੇ ਵੀ ਨਸ਼ਿਆਂ 'ਚ ਵੜ ਕੇ ਜ਼ਮੀਨ ਵੀ ਬੈਠੀ ਆ ਇਦੋਂ ਚੰਗਾ ਹੋਰ ਕਰਦੇ ਜੇ ਟੁੱਬਰ ਨਾਲ ਚੰਗਾ ਮੈਂ ਆਪਣੀ ਜ਼ਿੰਦਗੀ ਖਤਮ ਕਰ ਲਿਆ
ਬਾਪੂ ਤੈਨੂੰ ਕੀ ਹੋ ਗਿਆ ਬਾਪੂ ਮਾਂ ਦੇਖ ਬਾਪੂ ਨੇ ਕੀ ਕਰ ਲਿਆ ਤੁਹਾਨੂੰ ਕੀ ਹੋ ਗਿਆ ਤੁਹਾਨੂੰ ਬਾਪੂ ਨੇ ਜਾਨ ਪੀੜੀ
ਬਾਪੂ ਕੀ ਹੋ ਗਿਆ ਬਾਪੂ ਉੱਠ ਬਾਪੂ ਅਰੇ ਬਾਪੂ ਕੀ ਹੋ ਗਿਆ ਅਰੇ ਮਾਂ ਮੈਨੂੰ ਮਾਫ ਕਰ ਦੇ ਬਾਪੂ ਕੀ ਹੋ ਗਿਆ
ਤੇਰੇ ਨਸ਼ੇ ਵਿੱਚ ਤੇਰਾ ਪਿਓ ਉਠਾ ਲਿਆ ਅੱਜ ਉੱਠੋ ਤੁਹਾਨੂੰ ਕੀ ਹੋ ਗਿਆ
ਬਾਪੂ ਅਰੇ ਬਾਪੂ ਮੈਨੂੰ ਮਾਫ ਕਰ ਦੇ ਉੱਠ ਕਰ
ਆਪਣੇ ਹਾਲਾਤ ਨੂੰ ਦਿਖੇ ਕੁੱਕੜ ਕੀ ਹੋ ਸਿੱਖੇ ਆਪਣੇ ਹਾਲਾਤ ਦਿਖੇ ਤੇਰੀਆਂ ਬਾਤਾਂ ਵੀ ਖੁੱਲੋ ਗਾੜੀ ਮੇਰੇ ਨਾਮ ਜਵਾਨਾ ਹੈ ਤੂੰ ਮਜਨਾ ਦੇ ਜਵਾਨਾ ਔਰ ਪੀੜੀ ਦਾ ਮੇਰੇ ਮੋਢੇ ਆਪੇ ਪਾਰ ਮੇਰੇ ਨਾਮ ਜਵਾਨਾ ਹੈ ਜਵਾਨੀ ਨਸ਼ਿਆਂ ਦੇ ਵਿੱਚ ਜਵਾਨੀ ਨਸ਼ਿਆਂ ਦੇ ਵਿੱਚ ਕਾਲ ਬਾਪੂ ਵਰਗੀ ਛੋਟੀ ਜਿਹੀ ਚੀਜ਼ ਨੇ ਕਿਵੇਂ ਹੱਸਦਾ ਪਰਿਵਾਰ ਉਜਾੜਤਾ ਇਹ ਇੱਕ ਇਹੋ ਜਿਹੀ ਛੋਟੀ ਚੀਜ਼ ਹੈ ਜੋ ਪੰਜਾਬ ਦੀ ਜਵਾਨੀ ਨੂੰ ਖਾਂਦੀ ਜਾ ਰਹੀ ਹੈ ਤਾਂ ਬਾਪੂ ਨਾਲ ਬਹੁਤ ਵੱਡੇ ਰੋਗ ਲੱਗਦੇ ਹਨ ਪਰ ਸਭ ਤੋਂ ਵੱਡਾ ਰੋਗ ਕੈਂਸਰ ਦਾ ਹੈ ਜਿਸ ਨਾਲ ਪੀੜਿਤ ਨੌਜਵਾਨ ਅੱਜ ਹਸਪਤਾਲਾਂ ਵਿੱਚ ਪਏ ਨੇ ਸਾਡਾ ਫਰਜ਼ ਬਣਦਾ ਅਸੀਂ ਅੱਗੇ ਆਈਏ ਤੇ ਲੋਕਾਂ ਨੂੰ ਇਸ ਬਾਰੇ ਜਾਗਰੂਕ ਬਣਾਈਏ ਤੇ ਪੰਜਾਬ ਦੀ ਨੌਜਵਾਨੀ ਬਚਾਈਏ ਥੈਂਕ ਯੂ
Congratulations to our winners. Your performance was not just entertaining, it was thought-provoking, impactful, and delivered with a great energy and emotion. You have shown us the true power of street theatre. Now I'd like to request our judges of the Natak competition, Dr. Satnam sir and Dr. Monica, please join and come forward for prize distribution. I also request Dr. Hajiran ma'am and Dr. R.G. Sani sir to please join the judges for the prize distribution.
Very nice. All of you found well, but they were speaking difficult for them to do it.
And we have with us Principal Nursing College, Mr. Shridev K.S. I request sir, please come forward and join us. And faculty, please come forward and join us.
आगे बैठो सारे बैठो मैम आप
इधर मैडम मैम इधर आओ मैम इधर आ जाओ
थोड़ा सा इधर आ जाइए टाइम में ऑडियंस मैम आप इधर आ जाओ
Now I may request that is please Dr. Tanveer ma'am and Dr. Second. The first runner team is from Physiotherapy College. I request all the participants to please come forward for receiving the award.
एक थोड़े से बच्चे इसके आ जाओ बेटा काम पहले सर्टिफिकेट्स ले लो वो ना बैनर से वो टाइट आ गई आज हम बैनर साइड पे कर ये पीछे वाला बंद कर दो हाँ उस बैनर को साइड पे कर दो ये इस साइड से ले
थोड़ा लगे यार जनरल बंद हो
सर्टिफिकेट कम रहेगा कौन सी अच्छा मिल गया सर आप इधर आ जाइए आप हाँ बाद में वापस आपके नाम वाले
The third position was grabbed by teams from Paramedical College. I request all the participants to please come forward for the award.
Paramedical College
Participants from Paramedical College.
Please. With the certificate, you can rearrange with your names. That is certificate. Any faculty from the paramedical faculty paramedical.
Faculty from Paramedical College, please join us for the photograph.
बेटा आप पीछे आओ बेटा आप पीछे आओ आप सर्कल उधर को करिए सुना दे आप आ जाओ राइट हाँ इधर खड़ा
The third donor team is from Adesh Dental College. I request all the participants to please come forward for their award.
Certificates letter. एक
कोई बाद में चेंज कर
बाद में चेंज कर लेना जिसके नाम You can
तू सेंटर से आ गया तो मेरी मल्टी करी मैं मोटर कर देता तो सेंटर में ऑर्डर में दो
Congratulations to our winners of Karnataka competition. Now I may request Dr. Sandeep ma'am and Dr. Varun sir to please felicitate our judges and Mr. Sridev KB, Principal, Nursing College. Sir, please come forward so that we can felicitate.
Hello.
Thank you, sir. Thank you, sir. This was followed by a read competition. We will be playing. I request Kirit ma'am and Ferry sir to kindly come forward and felicitate the judges of the Karnataka competition, Dr. Sukham sir and Dr. Monica ma'am. Now we can play the deals from the real competition. The event was judged by our respected faculty members Dr. Rajvi ma'am, Dr. Kesu ma'am, and Dr. Amandeep ma'am.
This last reel has held the first position, and the reel that was displayed in the first has backward position, and the second reel was at second position. Now I request our judges of the reel competition, Dr. Rajminder ma'am and Dr. Gesu ma'am, to kindly come forward. Plus, I would request Retired Colonel Jagdev Singh sir, Honorable Vice Chancellor, Adesh University, and Dr. Pramod Kumar Goel, Principal AIMSR, to come forward and give the certificates to the winners of the reel competition.
The winners of the reel competition are Dr. Jagdev Singh, Ashir Mohammad Faizan, Mohammad Ishan,
पॉइंट बोलूंगा ये बहुत अच्छी चीज है बट अगर आपने इसको सोशल मीडिया पे कहीं भी शेयर करना है ना जहाँ भी स्मोकिंग आ रही है वहाँ पे नीचे वार्निंग आनी चाहिए ना तो जस्ट टेक केयर जहाँ भी अगर आप शो कर रहे हो ना इसके नीचे सिगरेट स्मोकिंग इज इंजूरियस टू हेल्थ वो वार्निंग आपको एडिट कर लेना वीडियो में के बिना शो क्या कर सकते
Participants, please come forward and receive their certificates. The participants were Dr. Jujar Singh, Mosheen Mohammad Faizan, Mohammad Zishan, Saruz Alam, Harul Anam. Second position was that Sabah James, Jasmine Kaur, Arshad, Junaid, Bintul, Preet, and Jasmine Kaur. Okay. The third position is backed by Dr. Sonam, Pratika, Gaurav Chauhan, Wasim, and Naveen. Participants, please come forward and receive their certificates.
Thank you.
अगर आपके नाम चाहिए तो we will give you the right one. Third runner up team is Kushi and Tukor. Please come forward for the Kushi and Tukor. दो जन आ जाओ दो ही आप इधर ही आ जाओ हाँ
I request our Vice Chancellor Sir and Principal Sir to please stay back for the felicitation of the judges, Dr. Rajvinder Kaur and Dr. Keshav Ma'am.
Now the results for scientific poster presentation. The first position was bagged by Shivansh Esher. Please come forward. And the session was judged by Dr. Sir. I request judges to please come forward. And Dr. Gurkiran Sir, please join us for the award. I request Dr. Harkiran Ma'am to please join. And Dr. Sani Sir, please join for this. The second position was backed by Sanya Prabhakar. Sanya, please come forward. And the team members may also join for the photograph. The third position was backed by Mayurika.
I request Harkiran Ma'am and Sani Sir to please stay back for the felicitation of our judges, Dr. Varun Sir and Dr. Gurkiran Sir. Thank you, ma'am. For the last competition, that is poster competition organized for MBBS batch 2022, the winner is Visi Mehra and Shilda. Please come forward, and I request the judges of UG poster competition, Dr. Kapil Ma'am and Dr. Ruchika Ma'am, to please come forward and give away the certificate. I request retired Colonel Jagdev Singh, Vice Chancellor Sir, and Dr. Pramukh Goyal, Principal AIMSR, to come forward and give away the certificates to the winners.
First one. They have brought the posters also. I found it actually.
Please get your certificate first. Okay.
The second prize goes to Shreya Goyal.
पोस्टर के लगते फोटो पोस्टर के फोटो खिंचवा लेना भी पता है
The second runner-up for the competition is Nirmal Sidhu.
बनाना
I request Vice Chancellor Sir. I request a Vice Chancellor Sir and Principal Sir to kindly facilitate our judges, Dr. Kapil Ma'am, Dr. Ruchika Ma'am. I request Principal Sir to stay back, and I request Varun Sir and Tanveer Ma'am to kindly facilitate a Principal, Dr. Pramod Kumar Goyal. Request Principal Sir to kindly share his words of wisdom with us.
कुछ वर्ड तो पहले बोल ही दिए थे मैंने बट मैं सब स्टूडेंट को ये बोलूंगा कि देखो ये आपने जो नुक्कड़ नाटक किया है जहाँ पोस्टर्स बनाए हैं डोंट लीव इट टू द नाटक एंड पोस्टर इसको अपनी लाइफ में इम्प्लीमेंट भी करना है ठीक है तो यू मस्ट नो कि जो टोबैको है इट्स अ वेरी डेंजरस थिंग इट्स नॉट ओनली डेंजरस फॉर लंग इट्स डेंजरस फॉर हार्ट आल्सो मैंने मॉर्निंग में यही बोला था बिकॉज ये हार्ट के वेसल्स की एथेरोस्क्लेरोसिस जो आपने पढ़ा होती है डर ना इट कॉजेज दैट so it is more dangerous for heart. Even tobacco heart नाम के एक टर्मिनोलॉजी भी है. That term is called tobacco heart. तो अगर किसी को हार्ट की डिजीज हो रही है because of tobacco, it is called tobacco heart. ठीक है? और इवन लिप्स तक खत्म हो जाती हैं. तो मैं सुबह भी वो वर्डिंग बोली थी मैं फिर रिपीट करता हूँ. Belly and love surgery की बुक है that specially says in the bottom either you will have your legs or you will have your BDs. तो ये आपने डिसाइड करना है कि BD चाहिए या आपकी legs चाहिए आपको. ठीक है so it is that much important so we should strictly avoid tobacco or any related products not only tobacco any related products उसको strictly हमें avoid करना चाहिए so congratulations to Dr. Tanveer and the entire team for organizing this program for creating awareness of this. Thank you.
Now I request Dr. Harkiran Ma'am, Dean Faculty of Medical Sciences, to kindly come forward and share her valuable insights with us.
Thank you for inviting me, Dr. Tanveer. And I was listening almost 50% of your seminar through the Zoom. So when Dr. spoke before also about not to use tobacco, I was very much there. And he has almost covered everything, but I'll say another thing, that it is bad for the secondary inhaler also. So if a husband is a chain smoker or smoker, cigarette smoker, not only he suffers, not only his wife suffers, but his child also will suffer from this disease. So it is, I think, more dangerous than the even alcohol, because alcohol only affects the person who is taking, but the smoking affects all of the family, children to be born, wife, and yes, I was very much impressed by the book conductors and all. But I again repeat, as Dr. Pramod said, that don't keep it to just dysfunction only, here only. It should be inviting you, and not only you, but you should impress others also, your brothers, your cousins, and the neighbors, and whosoever comes in contact with you, and you find that somebody is addicted to smoking. You must tell in detail what it can harm. A few years back, I visited boys' hostel, MBBS boys' hostel, and you will be surprised how much butts were there lying just outside their rooms. It was hundreds and hundreds. The whole floor was covered with brown, white butts. And even I found it in some boys' room also. And I was so surprised. Everything you read, everything you know, what it can cause, still the boys, and that too ambiguous boys who read they are smoking. So I'll request the Dr. Pramod to visit someday, surprisingly, not telling them, and see now what is the solution. That time it was there. We all should unitedly stand against it. Not only students can do, not only local artists can do, but we, the faculty of Adesh, we, the organizers of the Adesh, we should also take care and pay a heed to it. What is going on very much in our college before going to the parish. Thank you, Dr. Tanveer, for all the efforts you have done. And I'm impressed, very much impressed by the children. Until unless they keep their in mind also. That would not only just play and go, but it should be in your mind also that we are to stand against them. Thank you.
Thank you, ma'am. I request the principal, sir, Dr. Tanveer, ma'am, and Varun, sir, to come for the felicitation of our dean, ma'am, Dr. Harkiran Kaur. I now welcome Professor R.G. Seni, sir, Registrar Adesh University, kindly come forward for sharing his thoughts with us.
Takes me back to 1970. I was writing my thesis, PhD thesis, and I had portrayed Carol in the evening when I went to the washroom. When I came back, the door was locked. It knocked. The door was open, and I found two boys smoking. There was a lot of smoke in the heat. I saw the boys. I asked them, why do you smoke? I never smoked. I asked them, why do you smoke? They said, sir, relax all your mind. I was, right, we cannot relax with how it can happen. They have told me, they advised me that you have one of the first advice how you can feel that you are writing your thesis like the understand. So I did that. I took 2 hours. And I felt a little bit. So that was the beginning. So from 2 bucks, I came to 1 packet. 1 packet means 10 cigarettes. In 2-3 years, I came to 1 packet. But every time I used to have it, I used to have giddiness. So initially it was not there, but ultimately I started getting giddiness. And when I get up in the morning, there was a very bad taste in my mouth. Punjabi it was the same kind of. So and when I go to my children's bedroom, they also complain that of a smell area. I realize that it's not good, particularly that giddiness feeling which I started getting. So I decided that I would quit. So from 1 packet, slowly, पहले 9 कीतियां, फिर 8 कीतियां, रोज दियां, फिर 7 कीतियां. Ultimately, I came to 1 or 2 bucks. With one of my friends who had I felt so. But I think that was a bad period. I didn't get anything in any other disease, say, other than whatever effects I could see. But I could leave it. Say, I just want to tell my younger generation, these young people, that people might be trying to tell you that if you have 2-3 small or you get 1 cigarette, nothing is going to happen and you will feel that. That's not right. Ultimately, it affects your health the way it affected my health. But it is very easy to get out of it. You make a decision that you want to leave it. You can leave it. These days also you have an ad in the TV. There is a medicine that it can help to quit smoking. I don't think that even that will work. The thing that will work is your will to leave it. And I think it is more than 30-40 years that I never had. This is what is my message. And thank you, Dr. Ranveer, for this. Thank you.
Thank you, sir, for sharing your story and being motivations. I request any sir to stay back. And I invite Dr. Pramod sir and Dr. Varun sir, Dr. Tanveer ma'am for felicitation of our registrar sir.
Thank you, sir, for coming. Inspiring today.
एक व्हाट्सएप पे ना वीडियो सर्कुलेट होती होती है कि एक बंदे को आदिवासी ना उसको किडनैप कर लेते हैं तो बांध के उसको जलाना जिंदे को जला रहे होते हैं पर आदिवासी के पास अग्नि का कोई सोर्स नहीं होता तो आप कोशिश करते हैं तो वो उसको जला नहीं पाते फाइनली दे लीव इट की छोड़ ही देते हैं इसको क्या करेंगे इसको छोड़ देते हैं वो बंदा बड़ा फिर होता है कि आदिवासी ने बच गया तो मैं तो अगर में जाता है और उन्हें जाके वो सिगरेट पीना शुरू करता है आदिवासी
Thank you, sir. I now request our Honorable Vice Chancellor, Adesh University, retired Colonel Dildeep Singh, to kindly come forward and share his valuable thoughts with us.
Good afternoon, everyone. For giving me an opportunity to interact with you on this important subject. First and foremost, I would like to congratulate Dr. Tanveer and her entire team, the students, faculty who have participated in making such an event a big success. The idea is to spread a message, to bring in awareness. Okay, but the ultimate aim is much bigger. The theme of today's, this year's anti-tobacco day is from policy to prevention. It's very easy to draw policies, talk of duties on paper, But ultimately, the second part of prevention is a big task. And it has to be implemented on ground. One has to take stock of the entire situation as it is existing. 8 million people dying every year from this tobacco abuse, is an eye-opener and a matter of concern for each one of us. How can we contribute to prevention is the main aim what has to be addressed. And this whole day's effort, we have achieved much more than this by spreading the message of what are the lessons, how it can be curbed, how does it start, and what are the preventive measures which have to be ensured on ground. And I would like to emphasize that it's the duty of each and every citizen the world over to ensure that the precious human life doesn't suffer from such innocence. We are very lucky to try turbans. Our great masters, they have given us a kind of teaching that we got saved from all these lessons. And when we tried to explain to others, it was not, medically we could explain. It was a blind faith. Or whatever our masters had, they had anticipated, they had, visualized. And they spread the message, don't mind that. I can be proud of my community. That we have saved ourselves and we tell others also not to fall a prey to this kind of menace. But these days, there are much bigger distances. The drug abuse is taking much more toll than this particular aspect. We had to some extent forgotten about tobacco abuse. And now, of course, there are laws which are preventing you, and it's punishable, crime. So a continuous effort has to go in, and these days there is more emphasis to address the drug abuse problem, especially in Punjab, and the Honorable Governor of Punjab, Shri Gulab Chand Kataria ji, he has been taking the great initiative, going around the villages and the entire countryside of Punjab and spreading this message against drug addiction. That is another big challenge we are facing these days, and it's all combined. All these drug abuse, tobacco abuse, and COVID. And COVID is also big mass. And Shema Bela bolte hain yahan chलता hai. COVID. In a state where our gurus and peers, they had contributed much more towards spirituality. I can't understand how we have fallen prey to all this, and we can't live as superhuman beings away from all these matters. So the messages have been extremely nicely conveyed. And I would again like to congratulate the entire team. And the program has been meticulously planned and executed. I'm sure great message has been conveyed, and it's going to benefit the humanity in a big way. Thank you. Thank you very much for all the effort that has been made. And I don't surprise. Wish you all the very best.
Right, I request sir to stay back, and I invite Dr. Pramod sir, Dr. Varan sir, and the main man for felicitation of VC. Thank you, sir. Thank you, ma'am. Concluding this event, I now invite Dr. Shyam Mehra, Professor, the Department of Community Medicine at AIMSR, to deliver the vote of thanks.
Thank you for coming. I'm deeply honored to propose a vote of thanks on completion of today's CME from policy to prevention under IFSM and IRCTC to celebrate all and more. First and foremost, I would like to express my heartfelt gratitude to HSQ, Honorable Chancellor, and Dr. Gurpreet Singh, MSME, Adesh Hospital, who has always motivated us and gave us the opportunity to rise up. I extend my sincere gratitude to our Honorable Vice Chancellor, Colonel Jagdev Singh, for his timely leadership. He is the driving force behind all academic and extracurricular activities. I would also like to extend my warm regards to Professor R.D. Singh, Registrar Adesh University, Dr. Harkiran Kaur, Dean Faculty of Medical Sciences, and Dr. Pramod Kumar Goyal, Principal Consult. I am grateful to President and General Secretary of National and Punjab Chapter Liaison and Director of ERCDC for their presence and constant support. My sincere thanks to all the guest speakers, chairperson, and judges for sparing their valuable time and showing us their cause of wisdom. Next, I would like to wholeheartedly appreciate principals, team, head of departments, and faculty members of various engineering colleges of Adesh University for taking out time from their busy schedule to praise the occasion. I would like to immensely appreciate all the participants and their mentors from constant colleges of Adesh University for their notable effort. Last but not the least, I would like to thank the guiding light behind the CME, Dr. Tanvir Kaur Sidhu, Professor and Head Department of Community Medicine, Organizing Secretary Dr. Japni, other faculty members, teaching residents, all the staff from my own departments, counseling members, 22 batch students, for their sincere hard work and dedication. It just would not have happened without everyone's support. Without further delay, I would like to conclude by saying, life is like a lit cigarette. The past is ashes, the present is burning, and the future is up in this form. Don't let yesterday take up too much of today. So quit smoking. You are stronger than your addictions. With this thought, we end today's CME. Thank you, everyone. I request you all to kindly join us for
Okay.